cross was just too much.
I'm glad you're trained.
Custer County Board of County Commissioners will come to order. Let the record show today is February the 6th at 9:00 a.m. I would ask Miss Meredith Nichols if she would lead us in the Pledge of Allegiance.
To the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Hoo-yah!
Play ball.
Will you conduct a roll call, please?
Commissioner Flower.
Present.
Commissioner Kanda.
Here.
Commissioner Prince.
Here.
Attorney Clint Smith. No, today.
Not present.
And clerk to the board, Kelly Camper, present.
Thank you, ma'am. For the record, Attorney Smith is again in the hospital in Pueblo for the second day. They're still running some tests, and shortness of breath was the initial symptom, and they're pretty confident it's not a heart attack, but they just can't determine what it is, so they kept him another night. So sent an email today and let us know that. Amendments to the agenda. We have an item, but I believe we'll deal with it under commissioner items instead of amending the agenda.
I have none.
Okay, Commissioner Kanda?
A couple things, other items, but I don't need an agenda.
Okay. All right, audience introductions.
Vicky Bubis for the Sentinel.
Bob Jolly from the airport.
Trey Crossville Airport.
Lynn LeGrue, airport.
Gwen Marie Nelson, Extension.
Welcome. Thank you guys for being here. Appreciate it. Obviously, no attorney items, administrative assistant items. None. Okay. Public comment.
No commissioner items.
Oh, gosh darn it.
We just met
He's
yesterday.
flying along.
I know. Yeah.
He's got 12 o'clock in mind, and we're going to get out of here at
Getting
12.
on a roll. Commissioner items. Commissioner Prince, would you care to start, sir?
The only thing I have since yesterday, the three of us met with the water consultant. I thought it was very enlightening. Other than that, I haven't done anything the last 24 hours.
Thank you, sirs. Really, same with me. I mean, we all three sat in that meeting yesterday, and I thought it was time and money well spent. So
Very good meeting.
that would probably be all I have.
Okay, and the only thing I have, we did have a good meeting with the task force in the morning. I got the report back. Jay and I missed half of it. And she did send forward to all of us a request for us to put out a letter to the community and a couple of things like that. You've got them in your email, but I'll send them to you anyway. Also, I've got an update here on the current spend on the plan. I'll give both of them, one to you and one to you. And this is the what the contract value was, and that's where we are on it. For example, $1,500 for interviews with stakeholders, that she did way back in January. You can track everything that is allocated against what we're doing. And then you can see where she put in a new task force meeting too, which was yesterday for the 750, and we moved that off of Wetmore and back in. So then we're going to press down the process here, and we'll see how the time goes back on the joint meetings that we have scheduled. If you look on the second page, you'll see the potential new task force there for an additional 700, and maybe and increasing the length of task force 4. That comes to about $1,000. So we're good for now, and we'll just press on where we are.
May I ask a question, please? I heard, although I hadn't seen anything written, that Ms. Collins, Peggy Collins, resigned from the task force. Do you know if that's true?
She asked to be. She still wants to be engaged, but she would like to substitute somebody because she's got her husband has problems too that she's dealing with medically.
Sorry to hear that.
And so yes, and so that we need and I think she was recommending either Brian Anderson's wife, I can't remember her first name, and Debbie was there yesterday to step in. So I asked them to send it to us. Who's going to be the who do they want on there, and we'll insert them. Well, Peggy's coming and going.
I think that should be our decision who goes.
Sure,
on.
well, but they have to recommend to. I asked them to recommend to us who they want.
Sounds fine. Thank you. I just wasn't sure where we were going.
No, it's-
I had heard she resigned.
She didn't resign, but she's.
Okay, well, I received an email from Deb saying that Peggy was no longer wanted to be on the task force directly. Now, I'm happy she's still involved. I have no
She wants to
issue
be
there.
involved, but we'll see what
And
she
that's fine.
participates in.
That's fine. I just wasn't sure.
But we
whether-
do. I asked them to give us a recommendation so we could make sure that we're covered from that angle.
Thank you.
So the new task force meeting, that was not an original
No,
scheduled
it was never
meeting?
scheduled yesterday. That's when we moved forward because as a result of the meeting we had first, they wanted to do it early, and we wanted to see if that way we get them going, and then if we needed an additional one, we can deal with that.
Now, this does not include the additional funds that we
No,
allocated.
the things that are blocked are things. This would be included if we don't do the other two back. There's enough money to handle that.
Got it.
But if we include the other two that they're recommending, extending the length of time and another potential meeting if we wanted one. See here, popular new task force, possible. You see that listed below the. So it's we're within budget and our proposed what we thought we would allocate in case we decided to do those is covered.
With that. Okay.
And you got the dates there, so I don't want anybody confused. And I'll give you one too.
Okay. And are you sending those to both papers?
Yes.
Okay.
Okay.
And then we'll send the other PR stuff to both papers as well. Okay, any other, that's the only other item. Oh, and I think I mentioned that the meeting we had yesterday is good, and I'm looking forward to the meeting this afternoon, and it's still at 2, is that right? The snow's not scaring anybody off, is it?
Yeah.
It's snowing hard at my house.
Was it? Yeah, I know it's bad down towards Slida, and it is bad over toward Denver. It's going to be worse than it is here, so who knows?
Okay, thank you. Anything else, gentlemen? Before we move on to the search and rescue letter under commissioner items? Okay. Pat Fiore requested the commissioners consider, I think you have a copy of it, writing a letter of support for a EMTS provider grant.
I saw that, but I
Here,
didn't.
I've got. And so this is very similar to the letter we provided last year when they were requesting a grant for a vehicle. This year they're writing that grant and requesting radios, DTR radios. I would move that we approve the letter of support for search and rescue.
I'll second it. We did it.
It's been moved and seconded to write and sign a letter of support to search and rescue. Discussion. Hearing none, we'll proceed to vote. All in favor, say aye.
Aye.
Aye. Opposed, nay. Motion carries. That's signed, clerk. Thank you. And you said no administrative assistant items, correct?
Correct.
Okay, I'll give you this letter here just a second while you're here.
I'm on the commissioner calendar, seeing that it doesn't quite line up. Would you go through this and make sure that we have it up to date? Thank you so much. I appreciate it.
Thank you, ma'am. Okay, public comment? Anything for the good of the order? Okay, we'll move on. Staff reports, airport. We're 5 minutes ahead of schedule.
And we're gonna keep gaining time, boys.
I'm gonna try to keep it short.
Or did I just
No.
miss it? Okay.
No, we did not.
Good morning, sir.
Good morning.
I'm not gonna let
Sorry,
you get
I
in
was-
without you.
yeah, how are
Just
you?
saying
There you
hello.
go, Bob.
Morning.
How are you?
I am doing well.
Good. I don't believe we had any documentation from you ahead of time, correct? Okay.
I've been busy.
That's fine, no problem. Jay asked me, Commissioner
I
Prince
thought maybe
asked
I
me,
just
and I
didn't-
said,
I
no, I
didn't
don't
find
believe
it
so.
or
But then I
something.
thought I better make sure. Hello, Mr. Art.
Hey, Art.
Of course, we didn't have a staff meeting in January, so I thought I'd bring you up to date a little bit
Okay.
on what's going on at the airport. In December, we only sold 176 gallons of fuel. In January, we sold 236, and most of that is because of what you see today, the weather.
And smart pilots.
Yes. It has not been conducive to flying lately. Currently, we have 2,924 gallons of fuel.
2,900.
924. That is as of January 31st. We got 2,062 gallons gross of fuel on January the 18th, and it was colder than a well digger's patush.
I've heard that expression.
Yeah.
2,000, and how many did you buy?
Well, net was 1962. Gross was 2,062.
Would you care to expand on the difference between net and gross if they're delivering fuel?
Yeah,
The bottom out.
it depends on the specific gravity of the fuel when they deliver it. The colder it is, the heavier it is, and the
More condensed it is.
more condensed it is. So that's the net. The gross is what it is when it's expanded, and we get taxed
On the gross.
on the net for everything except for state tax. We get taxed the gross.
Yeah.
And what do you pay for, gross?
No, we pay for
Net.
net, and we got a good price, a really good price.
Good.
At our last board meeting, we talked about, we didn't have a quorum, so we couldn't vote on anything, but we talked a bit about keeping our fuel price where it is for now. And the average in the state is $4.62. So we're at $4.55, so we're in pretty good.
Competitive.
Yes,
That's
we're
good.
at least competitive, except with Spanish Peaks, of course, which is so.
What are they now? They raised it. $3.90?
Yes, and I,
Got to get an initiative with the town.
Tank and bring it over here.
Yeah, let's go. Let's go. And we'll sell it for a nickel more.
In the 70s, when the gas wars were going on, people, one gas tank got gas, one wouldn't. They'd go take a gas tank over and fill it up.
Wonder who's subsidizing that. Somebody's paying.
the county has to be,
Somebody's wanting to attract people.
or somebody is.
And so you guys are working on some initiatives to
Yes.
work with the towns to drive the price down a nickel or so.
Yes. And December the 18th, we had an inspection by Division of Oil and Public Safety, and they found out that our dispenser was off by 74 cubic inches per 100 gallons. You're allowed to be plus or minus 69, and we're 74. So we're a little bit out of tolerance. And there's 261 cubic inches to a gallon, so we weren't off by much. But anyway,
So we don't have to recalibrate, or are we?
we did.
You did, didn't you?
We did recalibrate it. We got it recalibrated on the 9th of January. We are now minus 5 cubic inches per 100 gallons, which bottom line means we're 1/10 of a teaspoon off.
So what you see is what you get.
What you see is what you get. If somebody were to pump 10,000 gallons out of our tank, which is impossible to do, we would owe them 4 cents.
Stop wasting. please.
Pardon me?
Stop wasting county money.
4 cents every 1,000
Tongue in cheek,
gallons.
of course.
No, that'd be 10,000 gallons.
Or 10,000, I mean. Jeez.
Yeah, we can only hold what, 6?
You only 6,000.
Well, no, we can only.
We can only
hold
do 4.
5,400.
5,400,
Let's.
So that's like 2 teaspoons. Or whatever it was.
For some reason or another, and I'll clear this up with the accounting folks, we're still getting charged for a CenturyLink fuel line, which we do not need.
He just canceled that.
Okay. I just got the
How much
bill.
was it? $100 or something?
That was $53.49 a month.
Yeah.
So,
Yeah, factor in that.
You figure how many teaspoons of fuel?
50 bucks buys about a, what is it? 10 gallons, that's 10 gallons a month we lost there.
yeah.
Yeah, I believe Vernon Roth, our IT person, told us yesterday that he had
Yeah.
taken care of that.
Okay, good, good. I talked to Vernon several times this week, and I think our website is pretty much up to date, although I'd like to get some new pictures for the website. Those are very old. You still see our courtesy car parked out in front.
Send you a few of the construction going on, that'd be interesting to people, I think.
Yeah, that would be interesting,
And
and
quite a few.
yeah, all our fuel system, our dispenser, and our card reader is different now. So anyway, when the weather gets better and
In August.
Yeah, sometime in September when the leaves change.
Yeah. we'll get
One
get
day
out
we
there
have fall and summer.
and get them some new pictures, and we got to get our approved minutes up to date. It's my understanding we're not as bad off as some folks, but we're in pretty bad shape where that is. We did want to talk about a couple of things. Snow removal and courtesy car.
Okay, before we move on to that, may I comment here?
Yes,
I'm on
sir.
your website, not the county's website. And it looks like you have 2 sets of minutes posted for
18?
2018.
How long do we have to keep those on there? Can we get rid of the 2 years prior?
I'm not aware that
I don't
there's
think there's a,
any time, so I know you've got, let me go back, sorry. 15, 16, 17, and 18, I'd say 3 or 4 years worth should be posted.
Okay.
I don't know how long we keep them at the county.
From what I can see, I've looked at.
you put these in a drawer anyway, don't you?
Yeah.
It's just not on the public,
They're-
and you can go back if you had to.
Yeah, we've got them all.
So that's not a big deal.
We just got to get them out there and posted.
Brandon?
If you bring me, or, well,
Yes.
I'm volunteering narrative. If you bring
Get
hard
Brandon-
copies, you can scan them in and upload them.
Yes.
That was my understanding
Yeah,
also.
so, and obviously you're aware of that.
Yes.
So the sooner we can get that done, the better,
Yes.
because we're kind of committed to keep these minutes posted.
And we will do that.
Okay, thanks for letting me interrupt you there.
Anybody else?
And your meetings are posted on that website, right? Meeting times and dates.
Yeah.
And if they change, you're keeping it up, right?
Well, right now we're leaving our.
There's copies.
I got that.
Okay, great.
The rules.
Yep, and the benefits. Yep, looks great. I got extra copies of them.
Okay. Anyway, to talk about snow removal and courtesy car, we did come up with some proposed rules, and this is just our first rough draft, and I wanted to give you all a copy of
For your
that.
meeting.
If and when we ever do get a courtesy car, these are, like I said, just rough drafts of what we think the rules ought to be.
Thank you.
Anybody is free to comment or,
You're going to discuss this at the next meeting.
yes, add to or subtract from.
Which is, what date is this?
21st.
21st of this month.
Yes, third Thursday of the month.
Right.
And we also, thanks to Trey, came up with some, what he thinks would be some benefits for the county and to the towns and to the airport for having a courtesy car.
Just a while, your pickup truck, is it just one bench or is it how many people,
Crew cab or not?
Crew cab.
so how many people could you put in that if you filled it with, in the front, of course, I don't want any of your people in the back.
Well,
Can you get 5 in?
probably get 5 in
All
there.
right, okay, thank you.
Thinking ahead there, huh, Jay?
Thank you.
Yeah.
It's fixed, it's $260.
Nice,
Right.
Good.
nice.
It was, if you don't mind, just so I can let you go. Art just wanted to let us know that the repairs on his truck were minimal, $200 and some odd dollars,
Good
$260.
deal.
And it seems to be at the moment running okay.
Who did it? Was it down below or here?
Yeah, I had to take it down there.
Thank you all.
Was it electrical? Well, good, that's great. Perfect.
Thank you.
Yeah, thank you.
Thank you for
Sorry.
responding.
Thanks, Art.
Sorry to interrupt.
all right.
No, it's
You
fine.
must have asked him to come in, huh?
I did.
All right.
I didn't mean to interrupt you, but
That's
there's no
quite
sense
all right.
keeping him long term. If you could just give a 2-minute, took me longer to explain it.
Ba-dum-bum.
Anyway, that's what we came up with for some proposed rules. And I know last time we had a courtesy car, there were some serious problems. And that's because we didn't have a list of real good rules.
And we weren't managing the field.
And yeah, that too. And when I first came on board, we had a courtesy car, and they gave me the pieces of paper that everybody had to sign, and that was it. So that's where we were at the time, and now we're in a different place. And we don't have a courtesy car, but we would like to have one.
Can I ask a question, please?
Yes, sir.
The car itself, I'm not overly concerned about, but there's always upkeep, gas, and all that kind of stuff with it. Would you consider, your board consider, maybe increasing the price of fuel by a few cents
We have
and
increased.
allocate that for upkeep and maintenance of a car if you had one?
I think that is a very good discussion to have with our board, and that is one subject that's going to be on the agenda for our next board meeting.
Just thinking.
And that's one of the reasons why we left our fuel prices where they are, is because we are generating, with the current fuel prices, a pretty good profit on fuel sales.
Great.
And I have called around to different airports. As a matter of fact, I called 4 yesterday to ask them. And to be quite honest, the last courtesy car we had, we never had to buy fuel for that vehicle.
Everybody volunteered.
Well, that was, some of the rules was
Bring it back full.
bring it back with the same amount of fuel in it as you took it.
Yeah.
And the pilots are pretty good about that, and sometimes they even donate a little bit of money. But I did call Kit Carson, I called Blakefield over in Delta, I called Fort Morgan and Mineral County over in Creed on their courtesy car, who owns them, and how do they handle their insurance. And all of them are either owned by the city or the county. That's who owns them. And Kit Carson, they told me that CTSI is still handling their insurance on their car, but it's never come up as a discussion. I think they're keeping it fairly quiet because over in Mineral County, over in Creed, They're sort of like our county, and CTSI said they would not cover the courtesy car. They buy their insurance through Gallagher. And over at Fort Morgan, it is a city-owned car, and they've got 4 of them apparently, and they buy theirs through a private party, but
Insurance?
yes, but the city pays for it. And over at Blakefield and Delta, theirs is bought through an FBO who's on field. So the FBO buys the insurance, but the county reimburses them for it.
I
But anyway, that's what I have found out so far.
Can I ask a question? The impression I'm getting is that most municipal fields, kind of like the one we have, smaller,
Yes,
unregulated, have a courtesy car available.
yes.
I mean, it just
All
makes
over the
sense.
nation, and
Yeah.
that enables them to get into the towns.
Yeah, I understand why. It just makes perfectly good
Hotels.
sense. Look what's flying in, and then stand there with your thumb out on 69 trying to get into town to get lunch. I mean, it just doesn't make sense. Unless we
Yeah.
had a taxi service or something.
Yes.
Of course, we don't.
Well, yeah, and that's why I picked these particular airfields, is because they were airfields that did not have a taxi service available. Much like our town, we don't have taxi, we don't have Uber, we don't have those type of things. So I was thumbing through our directory and found some counties that were rural and they didn't have rental cars or taxis available, but they had courtesy cars, so that's why I
So,
chose these
I'm
counties.
sure you've looked at your budget. Have you found anything in your budget that would help you
The-
purchase a car?
The only thing that we have that generates money is leases for property and fuel sales. And fuel is
Already allocated.
is about the only place, if we keep our fuel prices. If we keep our fuel prices competitive, I think we'd be able to handle at least the insurance and repairs and
Yeah.
things like that. And we do have a,
And you're looking at other money-making things.
yes,
You know, even if
we
it were
we
snacks.
talked,
and
we were talking about
food
putting
service.
the magnetic signs on
the
the
magnetic
side.
signs to advertise the business.
Advertising businesses here in town, the hotels and restaurants and stuff like that,
You get the restaurants to kick in
Right.
$10 or whatever.
and charge them $10 a month or $100 a year or something like that.
Well, without being specific, I'll just go on record as saying I think a courtesy car would be an excellent idea for the airport. How we do it, where we do it, where the money comes from, it's up for discussion, but I think the concept is certainly a good
Yes.
one.
Your next meeting, you also ought to take a look at, you looked at insurance companies, get some prices from them. I know
Yes.
Progressive is one that deals with aviation kind of stuff. They're kind of far out with different
Why
things
would it
that
not
they
be
do.
covered under our
It could be. He was
budget
just,
policy?
it could be. Then we need to check and make sure that's the case and balance the cost.
Yeah, CTSI, as I understand it, doesn't want to cover this
That's
because
correct.
they're not county employees driving the vehicle.
Right.
So
Oh,
CTSI is not
I
a
see,
player.
sure. That would make sense. I understand that.
We'd have to find private insurance.
Okay.
Yeah.
Yeah, I'm not opposed to the idea either. Certainly there's some concern about, is the county going to fund this whole idea?
Yes,
Or is the airport going to fund this? Obviously
Yeah.
by some of the things you just mentioned.
Or it's how they base their budget. You can, if you're going to drop something else, add some support that when we approve budgets, we look at.
as a matter of
But it
fact,
needs to include the whole picture.
as a matter of fact, next month, Jackie Hobby's going to be on our agenda, and we're going to talk about the cars that are parked there and possibly charging a fee,
Yeah.
a yearly fee for doing that.
And I was talking with her too about it. And in fact, other airports, even in Denver Centennial, I know it very well, and these others, they do charge you a fee to have a car, have your ability to have access to the airport and use it. And if we're leaving a car there, and people do that, they have the parking for people that fly out of there and spend weeks away.
Oh, by the
It's a
way, just for your information, that less than beautiful trailer is gone. And,
Take it?
I noticed this morning coming
Pretty simple.
here that the car is also gone.
Yeah, good.
Now, it wasn't parked on our property, it was parked over at the storage area, but it's gone too.
Well, the agreement or the intention was it would be gone by the 5th, so glad they
They did it.
do that.
It is gone.
Good.
And we also wanted to talk a little bit about snow removal. And we talked to Road and Bridge about snow removal, and by and large, they do a fairly good job. But there was some concern about some of the ice areas that were being left out there. And I think Lynn took the road boss out there and showed him, and explaining to him that airplanes have small tires and they don't like a whole lot of ice. And their brakes are not the
Break
same.
a nose wheel.
Yeah. And their brakes are not the same as on your average Cadillac. So there are some issues.
He said he talked to you yesterday. We talked to him.
Yes, I saw him.
I think he understands
Yeah.
pretty well what you need.
And I saw him again yesterday. And a couple of weeks ago, the area, they cleaned the runway and the parking area really well. They did a good job on it. But around the fuel farm was a total disaster.
Couldn't get in there with an airplane.
You could not even get close to being able to buy fuel. And we moved the snow there, and we've got some new members on our board now that are more than willing to get out there and
Yeah, I was going to
help us
ask
with
you.
that.
We have a snowplow out there. Does it work? Can you make it work for little things like that?
Yet we're trying to get it going again. I think it's probably going to need a new battery.
Some warmer temperatures.
And the
They get an engine heater on it. And put
Well,
it
no, I mean to work on the vehicle.
Oh.
It's out and it's exposed right now.
Can you put it in the other side of the?
yeah, that's where we're going to put
Once we
it.
get it running.
Yeah.
Okay.
And apparently, the battery is a new battery. We just bought it about a year ago, maybe a little bit longer. And there is something that is draining that battery.
Okay.
And I'm going to talk to Bob McDonald, who is also a good friend of the airport.
Right.
And he happens to be an electrician, and see if maybe he can't run down where that's coming from. So when we do put a new battery in there, at least it'll last. But yeah, those little areas we can take care of. But one of the things that I'm adamant about is we're not going to move snow from in front of people's hangars. That's a non-starter.
Sure.
Because of,
2 years of getting
Yes.
it fixed.
Yes.
I remember that project.
so we are going to
Just with
stay
a-
away from other
with a lawnmower.
people's hangars. If they talk to us and give us permission, and they want to put it in writing for us to remove at least,
Doesn't gain much.
yeah. So, anyway,
And your concern is what?
somebody
Knocking into a door.
knocking into a door, damaging their hangar, and them suing the county for getting it fixed. We had that problem a couple of years ago.
A couple of years ago, someone hit Dr. Smith's hangar. It wasn't a major thing, but it took over 2 years to get the repairs done.
I'm
For a
very
variety of
aware of that.
Tom helped put this tin.
So
That was mowing, that wasn't plowing snow.
Right.
But that's
Same-
why I
same-
say
Same thing.
if you
If
had-
somebody hits
issue
somebody's
with-
hangar,
Gotta be fixed.
it causes a problem.
We could get Guinevere to go out there.
Well, after our conversation with the road boss, Gary Hyde, yesterday, it sounds like he is willing to continue to plow that. Obviously, you talked to him as well
Yes.
about the fuel dump and
And changing the
need.
blade so it doesn't skim
Yeah, and the other thing on our truck, there are some things we can do to improve it. We need to get a rubber thing to put on the top, because when you're plowing with that
the
truck,
under the windshield. Doesn't it?
the snow comes up over the top of the blade and makes it very difficult to see, but we'll get that. So,
Yeah, I would guess maybe Road and Bridge has some conveyor belting that would
I'm
work
sure,
with that.
yeah.
Or flaps for tires.
I certainly sensed yesterday that Road and Bridge Department feels like it's their responsibility to plow snow on
Yeah.
the runway, and
Yeah. So anyway,
so.
that's all I've
And I
got.
specifically asked him if he expected to charge the airport for that, and he said no.
Great.
So, yeah, from my perspective, going back to that rental car, if you could come to the commissioners with an estimated price of the car, estimated price of insurance, estimated cost of the county owning that, then I think we can move forward with a conversation.
And we will,
Conceptually, we like the idea.
yeah, okay. And we will get some prices from some of these insurance companies and see what we can
And
come up
obviously, we
with.
have an insurance company right here in town too as well, so. Trey has a question?
Do the commissioners feel that the retired sheriff vehicle is not going to be available, and that the airport board should look at possibly donation of a vehicle or having to purchase it?
Both. Still.
So,
You heard Art Nordike's got an issue
We
too.
would-
right, but, and it was my understanding that 2 of the sheriff vehicles were going to be rotated out. The Salida vehicles are ex-sheriff cars. And so when you ask us to estimate a cost, we can certainly do that if we're going to go out of pocket and go that way. But it would also be advantageous to us if we could use one of those county vehicles.
Sheriff will be here today to discuss an item under new business. We can pursue that a little more. I haven't talked to him since initial conversation about those vehicles, so.
And it,
If we could get placement of one, we could go from there with the expense of keeping.
and it
Yeah.
appears that there is one of the board members that's willing to donate a vehicle. Now, I don't know exactly how that would work as far as ownership and,
Sell it to the county for $1.
yeah, sell it to the county for $1 or whatever so that the
Write
county
him
would
a
own it.
donation receipt or
Right.
for
And,
deducted.
We'll look into,
Let me interrupt you just for a second. Mr. Barr, are you here for the agenda item today? To discuss the
later
jail?
one.
Pardon me?
The later one
Yes.
with Shannon. Shannon's running a little bit late.
Okay, that's fine. We were discussing, do you know if the sheriff's department is still planning on taking 2 vehicles out of service?
Yes.
And do you think, I don't know the vehicles, do you think one of those could function as a courtesy car at the airport or not?
How big's their maintenance budget? Well, I'm serious. They both
Well, it depends on how many volunteer mechanics they have.
230,000 miles, and that's why we're rotating them out.
Right. Yeah.
They need repairs.
It's up to you guys to analyze the vehicle and think about what the cost is. Think about it.
They're not rotated out yet because we're still waiting on getting the other one put back in the
Right.
fleet. But that's kind of where we're at.
But you got all the records on how the maintenance has been and what the costs are, so you guys could take a hard look
Yeah.
at it.
They were all bought new. It's just
Right.
how many miles?
230 roughly on both of them.
Change the engines out in either one of them,
No.
so, and transmissions,
To look at
One of them's had a transmission.
so take a hard look.
Sounds like it may be a possibility, something they could look into, the airport. Okay, thank you. Anything else, sir?
No, sir.
All right, very good.
Good job.
Thanks for coming in.
Thank you.
Yeah, on the 21st.
Not a good week for me to move the table, apparently.
We'll get it.
Yeah.
Sooner or later.
How many chairs do you guys have down there typically for your conference room?
I think we We counted up 17 the other
I was
day,
gonna say half a dozen anyway.
plus the
6 or 8.
plus the little ones
We have
rounded
some
up.
surplus office chairs in the basement. If you get that conference room, I would think that
It's a good idea.
commissioners would entertain a conversation about utilizing some of those because we're replacing those in some of the offices. I think there's 5 or 6 down there.
I didn't give away my budget.
No, I wouldn't give away your budget chair. That's ridiculous. All right, thank you, sir. Appreciate it, Bob. Anything else in
Give
the
Clint's
airport?
away there.
Okay,
And get him
we'll move
one
on.
better.
OEM, good morning.
Good morning.
How are you?
Doing a little better than yesterday.
Cindy.
The sniffles.
Yesterday was rough.
Yeah. Yeah. Got germs.
The germs?
Got germs.
Oh.
Yeah. Now I'm feeling.
Yeah. See you guys.
See you 3.
Had the little sniffle thing
Yeah.
going on for a few days.
Ah,
Not like some of the people around the building. Knock on wood.
Your show, Cindy.
Okay, well, I'll bring you up to date on the grants. 2019 Homeland Security Grant. It goes in a little bit later this year. That's money we can't spend till 2020 if we get it. But right now, the only thing that I've got on tap is we'll probably resubmit Art's coroner vehicle again. They weren't in favor of that project last year, but they have been buying vehicles through that money. I've seen my spell check isn't working on my program. The 2018 grant, the fence, the approval's in from the state. We're just waiting for the approval from Homeland Security, and that got pushed out because of the shutdown. Shannon said yesterday that because of the AT&T tower that we're not looking to start installation until after that anyway. So there's time on that grant. It won't be an issue. And then I've got some money left in MRC and VIPS grants, and we were looking at putting that towards radios, whether it's the programming costs or the extra batteries as we move ahead in the radio projects. So we've been working several agencies, search and rescue, EMS, and then Shannon and E911 trying to get some different grants in for radio. So we've been talking to Motorola, and now we're talking to Kenwood because of the way the Motorola pricing is. So.
we signed a letter of support for DTR radios through Pat this morning.
Oh, good. Okay. Yeah, I know that's going to be floating around agency to agency to get those letters of support in. The EMS and search and rescue are going for the provider grant, which is a public health grant, and that one's due on the 15th, so that's the quickest one. And then I think the one Chris is working on, JAG, is due March 1st.
Hey, Cindy, on the 2018 grant, you show security fence. Was that 0? And then what's the 30? Breaking your code here. You have 0 and 30,000.
Sheriff's office.
Sheriff's Office.
Yeah, but what's
SF.
the 0 mean? $0.
That stands for
So is
Sheriff's office.
Sheriff's office.
Oh,
Abbreviation.
Ah.
Sheriff's office.
thank you.
And while we're at that,
Good grief. I didn't.
VIPS.
VIPS. MRC is Medical Reserve Corps. VIPS is Volunteer and Police Services, and they are programs under what FEMA calls the Citizen Corps program. So those grants were under there. So your VIPS is your posse, but as far as the actual acronym, so the posse part is pretty easy to justify towards radios and batteries. I don't know if Alyssa will have any other use for the MRC grant, or that I'll even go after any CCP money in 2019. Those are harder to manage because they're smaller grants, but you still have to jump through the hoops of making sure everything is compliant. And before Troy left, this money's for the posse's been around since Rich and then Troy, and then by the time Troy would find out something wasn't approved, he got real frustrated and just said it wasn't worth his time to even mess with this grant. So I think we'll get it out in radios and just be done with it. And unless somebody has a specific project they want me to present, I won't just throw something in. But the CES group knows. We talked about that, and if somebody else has project ideas or needs that we have, we can look at that. the light tower we have with the portable generator, that was one of the Homeland Security grants we did. Basically, the only thing outstanding on my income side is fourth quarter EMPG. Every other grant has been paid back in, and my total deposits were $413,000 last year on those grants.
Amazing.
The Ready, Set, Go grant, Casey Wood Products has that. That's Kevin Langley out of Florissant. We had 10 vendors show up on the RFP, got 6 bids all over the map, and we awarded that to Casey Wood Products at about $1,300 an acre. The project scope right now is just 34 of the 50 acres, and there's an extension in, so once the federal government lets us know they're open for business and they've reviewed that, I'll know if that gets extended until April. Otherwise, we're just working to get the 34 treated, and we'll stop where we are.
And you did let that out, that contract?
Yeah, the contract's all done, executed, and
Oh,
he's
excellent.
moving equipment on site today. So
Really?
Kevin has a masticator. There were a couple of the vendors that did, and so he should be able to make some short work of some of that.
So it's a 1,300 an acre. Huh?
Yeah, and so it's limbing, thinning, taking some hazard trees down, and then they're doing
Did you ever
some.
see one of those things work?
Yeah,
Man, they chew it up.
yeah, and so it was interesting RFP for me to even have the chance to work with Carrie was a lot of fun, but there's a lot of groundwork to get this mitigation stuff moving, and it's something I heard from some of your economic development meetings that people are interested in fire mitigation and getting these projects done, but without the help of my nonprofit partners, I was totally in over my head on that one. Other than that, just some of the meetings and trainings, the Citizen Corps Community Emergency Response Team, we used some of that money to do an EMR training, so we've just finished that up after 5 weeks and on the weekends, and we'll have a CPR class on Saturday, and then we'll be done with that. Folks will be looking to get their national registry credentialing done. Been working on some salamander IDs. The Ag and Disaster follow-up, we'll do our workshop. Salamanders, the little credentialing cards. Yeah.
Thank you.
So a lot of people had IDs that expired because we're only allowed to print them for 2 years at a time. So we redid most everybody, and I think we'll be working on Road and Bridge next. So yeah, I printed a bunch of those. I've got to order some more materials. Web EOC, you may have got a test the other day to see. We're updating that list so that we have a way to communicate, and you'll get those.
I'm assuming you didn't need a response to that.
No, didn't need a response, and it came back where it was undisclosed recipients. I couldn't see it anyway, but Christy Coleman gave me the list of everyone, and so I had to do some shuffling around. We've got, some movement at the fire department, and so I think that one's, as soon as Krista gets that finished, we'll probably do another test just to make sure we got the new folks on there.
So what did you find out on the price of the radios? You said you talked to.
So Motorola, we met with Albert County, came to the last emergency services meeting, and there have been some deals in the past for volume where they brought the pricing way down.
You're not going together on.
Well, yeah, we're trying to get volume pricing, but as it turns around, the Motorola sales rep, they just came back to the state bid price and gave us.
They're pretty hard nosed.
They're pretty hard nosed. That's a good way to describe it.
Monopoly.
So
It
yeah.
is. It really is.
So basically, the EMS and SAR ones we're looking at still $2,800 a radio, and I think the initial Kenwood bids are coming in at what, $1,800? I think is.
Yeah, there was about an
$80,000
$80,000 difference in the JAG grant that I'm working on between Motorola and Kenwood. Kenwood includes everything in it. The radio. Motorola wants to charge us for
Everything.
programming and
Really?
the baud. It's ridiculous.
And I think what they're doing is bigger areas where you're not submitting a grant and they're not on the hook saying they're going to give volume deals. I think
Right.
some of these agencies are getting radios for like $1,400 a radio.
Is Kenwood as reliable or as
We don't know.
as rugged?
We've reached out to some agencies. Kenwood been responding to Shannon and I for a couple of days. We've reached out to some agencies that recently went with them to see what they think.
Yeah.
Try to get some opinion on it.
Ideally, we'll all use the same portable radio, including fire, and it'll make training
Well, yeah, you
easier. The sheriff's office will look at bringing in an encrypted channel on their radios, and there's some potential grant money in 2020 for the fire stations. I'm not sure if it's a FEMA grant. Well, it's supposed to send it to me, but our grants will be, our radios will be 15 years old next year, and they want to start replacing them and helping firefighters, and so this new grant is only for radios that are 15 years or older, and so I have a feeling a lot of people are going to apply for that money next year, but I am trying to get more information on it so our 2 fire departments are ready. I also sent 3 of my radios out and transferred them to Wetmore Fire and got them reprogrammed. Wetmore Fire is going to pay the bill. Wet Mountain Fire is supposed to give Wetmore 4 more radios on top of that, and we're trying to solve the issue of toning them out versus trying to use code red. They're also looking. Alex is looking at FFRS, and I am responding in some of those other apps, but they cost money, so I'm not sure. He and I have a meeting Thursday morning to kind of go over everything he's working on as far as the code red, the iPods, the FFRS, and other options for Wetmore Fire. So yeah, that's been kind of a effort going on trying to figure out where we should be. And then
Question about code red too.
Mhm.
Is that notification county and the 2 municipalities?
Yeah, it's countywide.
So if there was something here in town,
Yep. So once a year we update all the landline data, and then cell phone users have to register themselves, and then you can register an email too. And then when Alex builds out different groups, he could build a group of everybody in the town of Westcliff, everybody in the town of Silvercliff. He can have predetermined groups set up ahead of time, but then you can also go in and create a group on the fly during an incident. So if you were evacuating everybody in the 600 block, but you didn't want the house where a shooter is barricaded, you'd say everybody in this area except this address, because you don't want them to know that you're sending out the notification. It's got a lot of powerful features, but yeah, it's countywide.
and that has to be, people have to sign up for that annually?
No,
Okay.
they just need to register their cell phone. And then we try to clean up some of those. What happens is a lot of people register their cell phones and then they forget their passwords and they don't delete themselves from the system. And now they're living in Florida and they're calling me up saying, "Can you take me off this list? I'm not concerned there's a fire anymore." So that part's a little bit more difficult to clean up. But yeah, we'll be getting into, I think in March is when we renew the contract, is when we can start working to clean up some of those phone numbers. And we can do another all-call test like we did in April, because they got rid of the unlimited, or they got rid of the restriction on minutes and it's unlimited now. So I think an all-call test is once a year is a good thing.
There's not an embedded opportunity to unsubscribe once we get a call out on code red, like it says press any key to hear this message again, press 4 to unsubscribe, or
I don't believe so. I've never heard that one. But if somebody comes in and sends me an email or leaves me a message, I can unsubscribe them. Yeah, there's a way to remove them from the list. So.
okay.
So, you're a half a person down.
My rock star's in the back of the room.
I know, your star, KMR star. How's that affecting you, if any, and what's the status?
I think the biggest area it's going to affect me is trying to do some mitigation projects. I'm just going to have to pick and choose. and say no to a lot of people. Christy Coleman called me the other day and was trying to get me fired up to work on a project, and I said, yeah, and when am I going to have time to do that?
Is that something that takes specific expertise, or could a temporary person help you, or maybe even a volunteer from the community?
Yeah, I've got one gentleman, I don't know if it'll work out, but I'm recruiting him to help me with the CSF 11, so I've invited him to the meeting. He's a retiree with a lot of energy, and hopefully I'm not sure the personality is going to be quite right, but I'm trying to give him a project
Good.
to
But
do.
you're thinking in terms of getting some help for the specific times you need them. I'd hate to turn services away because you're too thin and,
Yeah.
help.
As far as the mitigation, I think that's why I mentioned in a couple other meetings having a discussion on these PILT funds and who's spending them and how we're doing that, because several people are very interested in spending those. We did do some publishing in Corona Verde once they get their CWPP done and then get their Firewise community done. Some of that funding can be used on mitigation, but I think it can also be used on some of the tanks that Round Mountain wants, or Wet Mountain wants to bury. So that part, might be a nonprofit organization we need to collaborate with. The Middle Arkansas Wildfire Prevention Partnership. We're a member of that. It's 3 counties. It's Pueblo, Fremont, and Custer. They want to go for a grant for about $38,000 for an administrative person to do mitigation. And then the talk at that meeting is if we used PILT funds for the specific counties to do projects, they would have funding to get a project going. And so we've definitely got some money in the pot there. And John Grieve, who's our state forester through CSU, we were talking at the last meeting about if we did this and got the person hired and got the grant, where do they work? And John and I had just had this meeting with Corona Verde, and they won a project, and they've got like 19 homeowners that went in. So that might be an opportunity where it's a private-public partnership, and I'd like to pursue that.
Well,
Otherwise,
please come to us if you feel that the county's not getting the services it needs because you're too thin.
okay.
Let us work with you and try and help something.
Okay.
I want our county protected as much as possible.
Okay. Well, and that being said, I would sort of anticipate, and I know it's your call, but I would sort of anticipate that if we had a big need and an emergency and an EOC, that there's somebody in the back room that could be activated to kind of help out, because she's going to know a lot.
Who's in the back?
We'll call Brenda back in from her new position to do that.
To come help. or if I'm out of town for the weekend. Well, we've got some redundancy. I
We're
think
going to do
that's
what
good.
the county needs.
Yeah.
What's best for the county.
Right.
Yeah.
Is
So
the Middle Arkansas group quarterly meetings? And how often they meet?
the MOP group, yeah,
Middle Arkansas.
it was bi-monthly, but they're trying to go to monthly for right now to get this figured out, how to move forward and get them into an actual green mitigation. They've been pretty much prevention and education, but they want to go into mitigation. And I've got to reach out to Jonathan Bruno on the grant and see if that's a possibility. But they're meeting monthly for now. They're meeting in Canyon City, and I talked to Amy Daniels, who's the chair of that right now. And I told her I've got some folks up here in Corona Verde that, because they want members to join and to actually run. They need somebody who's going to be a spark plug and run their organization. And I told them if you had the meeting up here, I'd invite these Corona Verde guys, because they might be your spark plugs, but they're not going to go to Canyon. So monthly, the next one's, I think, mid-February. Any other questions for me?
I do not.
You're good. Thanks, Cindy.
Thank you.
Yeah, you're welcome. I was just looking to see when that MOP meeting was on the calendar.
I sent you an email.
All right. I'll
Okay.
find it for
Yeah,
you. and
let me know.
Okay.
Shoot that date to me when you get it, would you please?
Okay. Yep.
Thanks.
I
Appreciate
will
it.
text it to you.
All right, thank you. Miss Treasurer. Mrs. Good morning.
Morning.
How are you?
Everybody's
Right, there
missed from the south.
How are you today?
Good. Good. You guys are doing good?
Yep, doing pretty good. Thank you for dropping these by this morning.
On a personal note, thanks for your help yesterday.
Oh, you're welcome. Wasn't much help.
Um,
I can tell you.
Miss Meredith tracked down a question we had yesterday about reimbursement of fuel used by the fire department through Road and Bridge. So they reimburse directly, I think she said directly to Road
Yeah,
and
we
Bridge.
don't have anything to do with that. That's between Road and Bridge and Fire Department.
So you never see that paperwork?
But Donna does, right? Theoretically.
She should if
Keeps
they're
track
getting
of
the
funds.
vouchers,
Yeah.
because they have to voucher it.
Yeah, I've never seen a voucher on it, but I don't know.
Well, that's an internal one, so how does, that is a good question. Wonder how.
Road and Bridge wouldn't voucher it anyway,
It would-
because it would be coming from the fire department.
That's
So
right.
That's right.
That's right, it would be.
We receipt it, but we're not involved in the middle part.
Right, your office receipts it.
Right.
That's what, yeah,
Yeah,
okay.
we receipt everything in the county, but yeah, we're not involved in the billing, that sort of thing.
Okay, thank you.
Any unusual anomalies, anything we should bring you could bring to our attention that we're not seeing?
It looks pretty good this time. Numbers are all good. A lot of money's gonna go out though.
Busy month, huh?
Oh yeah, we had a pretty good collection for the taxes.
Early.
And well, no, it's about normal.
Well, I guess,
Yeah. Yeah, some people like to get it
Get it
paid.
out of the way and
Yeah.
not think about it.
Now we have second
Not me.
half is due at the end of this month, or first half is due at the end of this month, so.
I'll go ahead and I'll move that we accept the treasurer's report for January 2019 as presented.
Now, let me second that.
Been moved and seconded to approve the treasurer's report, January 2019. Discussion? Hearing none, we'll proceed to vote. All in favor, say aye.
Aye.
Opposed, nay. Motion carries.
Well done.
Okay, ma'am, thank you. Appreciate it. Anything else?
No.
Good? Thank you. Thanks for coming in.
Thanks for keep getting us up on the schedule. Catching us up.
Quick help.
With a new hairdo.
Let's not talk about it. Let's not talk about it.
I like it.
I like it. You and my dad, you're the only people in the world. I like it. Give me a hard time about it.
Spoke to your husband about it too, by the way.
He likes it.
That's what I mean, it was weird.
He is weird.
How you doing?
Good, good.
Good.
All right. So I guess I'll start by asking if you guys have any questions about my report. That might be the easiest.
Nope, other than there was a blank page in it, but that's...
You know what? Let me tell you something about the computer situation. That brings me to a great
Let's talk about
segue.
How is that?
It's improving.
Okay.
So we now have great internet service on our laptops.
Oh.
Our desktops we can't get switched over because they're hooked to the server
Right.
at the clinic. So, I mean, not that we can't, it's just going to be a more tedious process for Vernon.
Vernon said he was working it.
He is working it. But that being said, I don't know how much I'm going to go talk to him because I don't know how much we really want him to work on that. Because, so we ordered 2 new laptops, one for Rhonda, one for myself, and the laptop that I'm using now will just be our backup because it's a little less, the processor's not quite as good for like doing everything. So what I want us to do, because of the COOP plan that I'm writing now, is just have everything on our laptops, and then we take our laptops so that if we have a giant storm or a snow or whatever, we're mobile and we can just do everything we do from home or wherever we need to go.
Do you back those up in the cloud or something? Good.
Well, they're going to be we'll be backing them up. We're getting a server of our own over there. I think it's going to cost us like $400, which is totally fine for us to back all of that stuff up. So, so that's where we're headed with that. So just so you know that because my computer literally will not let me, like, the backspace doesn't work to make the clear page go away now. I'm like, how old is this computer anyways? So, I'm really excited about that, because not only are we meeting a ton of deliverables by doing this update with my COOP plan for emergency services, it's just going to be better for us, and we can, like I said, we can pretty much be mobile and work wherever we need to.
Yeah, Vernon indicated you went from 4 up and 4 down to over 40.
Mm-hmm.
So that's pretty huge.
I know.
We were
It's
excited about that.
It's like breakneck speed.
Good.
It's craziness.
Good.
So yeah, I'm excited about that. So that's the biggest development actually in public health right now. But since I wrote this report, we also have a positive pertussis in Custer County. So here we go. Hey, you stop it in the peanut gallery. So let's just say our prayers about that, because 30% of our kids in school are not vaccinated because they've signed the waivers. So we could spread this pretty quick. So hopefully we're on top of it, and they're, staying home and being prudent with that. But yeah, so the last thing I really want to talk about on my agenda is, in developing my COOP plan and rewriting the EOP plan, which is our emergency plan, I realized that our biggest gap is in Rhonda's position, and not in that Rhonda doesn't do a good job, because she does, but in that the depth in her position is super shallow, because she's the only one that does her job. And so if something happens, Rhonda, our administrative assistant, and so if something happened to her, she does a lot of things that we would be kind of hosed. I mean, it would take me a couple months to get back in the swing of things. So I'd like to look at possibly hiring a PRN person. Not only that, but she takes, a fair amount of sick days. So if I had a PRN person that could do her job and be efficient at her job, I would feel a lot better about the depth there. Because Beth can do my job, Carmeline can do Beth's job, there's good depth there, but Rhonda does a lot of stuff for health fair that I don't even know.
So the person you're thinking about, do you have someone in mind?
I don't.
Okay. Would it be hard to find someone to do
I don't
this
know.
on a PRN basis? Because that would kind of be just a temporary job as needed.
It would.
At X amount of dollars.
Yeah, and I'm thinking just a little above minimum wage, because it doesn't take any schooling to do her job. It's just,
Understand.
It's
just training.
It's just on-job training.
How to do it, yeah.
So as far as the budget goes for that, we have funds in VaxCare. We're making enough money from our vaccines that we can cover it with that. And as far as our grants go and everything, we wouldn't even need to pull out of our grants. We could just use the money that we're making off of VaxCare. And now we're billing Medicaid as well, so that's going to be even more funds coming in.
Is it an allocated fund of VaxCare? I mean, is it open for you to use for anything you choose?
It is, because we put it in as a line item.
Okay.
So, what do you guys think about that?
Yeah, it's probably a good
Consider
idea
it.
to have
That's an excellent idea.
somebody in the wings.
Look at Miss Trujillo just a moment ago thinking, what would we do if she decided tomorrow just to walk away?
Right. Well, at least she's
All
got
of our positions.
Susie.
Susie.
Susie, thank you. Just went right out of my brain.
No, I understand, but I really
Yeah.
worry about
Yeah.
If someone,
Mm-hmm.
gets a fantastic offer and says, I'm going to the Caribbean with this new jillionaire who just flying me down there, you know what I'm saying?
Right.
Nobody's permanent.
Right. So.
North Colony
Millen over.
Amish School.
Mm-hmm.
Is that on the west side of?
It's Colfax, isn't it?
Colfax, thank you. I wanted to keep saying Colony. On the
And
west side.
Schoolfield, yeah. 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 It's I don't have the address in here, but yeah, where we're going is it's like right on that corner of Schoolfield and Colfax, I think.
Bless you.
Yeah.
Below
So
the meat packing factory.
yes, yes. So I think we have like 20 kids we're gonna do there. And then hopefully that'll open the doors to do some others.
Good. Yeah, I said west side. South of.
South of
West of
Schoolfield and
Colfax.
west. Yeah. Colfax, yeah. So that's it.
Good, all right.
Can I ask a question?
Yeah.
May I, please?
Certainly.
I know there's a movement afoot throughout the United States not to vaccinate their children against diseases that have been dormant for a long time. There's been at least a small resurgence of some of those.
There's a weird disease going
Smallpox,
around now.
Measles, those kind of things that you're talking about here.
Hey, they're almost done.
I would love to think it's just an educational process that parents understand that, you really are doing not only for your child, but for the kid next to him who gets sneezed on, that kind of thing. Do we have, or do you have, or would you consider an educational seminar, something to help parents understand? Now, I'm biased, and I have fully say that I feel if we have the medical know-how, we ought to use it, and it could save lives, probably has saved lives, and we probably lost lives for parents who've chosen not to vaccinate. So I'm wondering, do you have a program? Are you concerned about this? What are we doing about it? Anything or nothing? And it's fine if we're not. I'm just
No, it's not. I mean,
Parental rights.
there are parental rights, and it is a choice.
that's why. I'm
And this
thinking
is America.
education I'm thinking education is the key to this.
It is, and I know people who are highly educated who choose not to vaccinate their children,
Right.
and that's a choice. That's their choice.
And I understand that, and I respect that choice.
Right. That being said, as do I, completely.
Understand.
I mean, it's my choice
I'm really
to
concerned about
chop my
the
hair
kid
off
next
if I
to
want.
I'm really concerned about the child who's.
Right. So that's what we call herd immunity,
Thank you.
and the herd immunity
Never heard of that, but okay.
concept, where if everybody else is vaccinated, then I don't need to be because they're not going to get it, so I'm not going to get it.
Right.
Right? But that's starting to fall to the wayside because more and more people are not vaccinating, and then they are getting pertussis, whooping cough, or measles, something that we don't even know what is, this thing that's coming through Denver right now that looks like polio.
Yeah, that's right. That's what I was trying to think.
Yeah. So,
Is the one case you have, were they vaccinated?
no. I looked that up this person. I just got this morning when I walked in, this report that we have one here.
Well,
So-
I'm not trying to make an issue. I'm sure.
No, I agree, and it should be an issue.
Well, I mean, I'm certainly not interested in laws saying you can't
Right.
go to school unless you have.
Nor am I.
I'm not going there at all.
Right.
I agree with Commissioner Flower when he says it's parental right.
Yeah.
But what I'm concerned about is the innocent person next to the one who chooses,
Mm-hmm.
makes that choice, who doesn't have the choice, and it flows over to them because of sneezing or touching
Mm-hmm.
in the school. That's what I'm concerned about.
Sure, I understand that, and I completely sympathize with that. I mean, I agree. And I'm more than willing to do some education. There's actually a class coming up. It's in like Baltimore in May that I kind of like to go to because it's all about what has gone into developing vaccines, why they're safe, why there's a misconception that they're not safe.
Yeah, they,
I would
think you're getting the disease.
I would like to go to that
Injected.
because I could speak more
Budget.
intelligently
It's in your budget.
to people
You have the right.
who are, argumentative about it, I guess, for lack of a better word. But like I said, I know people that are highly educated that know,
That's
and
okay,
they
that
still
doesn't mean you
choose.
can't have a
So-
program
It's a
that
choice,
just says,
I mean.
here's
Here's
what we
the
know about
information.
diseases that are
Yeah.
going around.
Do with it what you will.
FYI, they need to
Here's
be
the information.
informed enough to decide to or not to do it.
Exactly. Because
their right to
for
do it.
every one person that is highly educated, there's probably 10 that aren't.
Sure.
And that's
Well,
my
even
job
if you're
is
highly
to
educated, is the
educate
point,
them.
is
Yeah.
to understand what's going on with the disease so that a highly educated person can make a decision to.
An educated
You need to
decision.
Make an educated decision, get the facts, and then you can make your decision.
Yeah. So
Okay.
Yeah, I would hope we would address that at the health fair as well.
there will be some information at the health fair. And we're doing the kids corner again at the health fair, which I guess I should have talked about that. The health fair is scheduled for April 6th. I'll see your smiling faces there, right?
Yes, ma'am.
RSVP'd.
I didn't, I'll RSVP now.
Okay.
And write it down. I haven't
Okay.
seen the email.
April 6th.
I've been negligent.
See how you are. Oh, one other thing I should tell you about. I checked all the AEDs. I did them myself.
Get them in there.
Saved this county $1,855.
Amen.
Yeah,
Thank you.
by doing that.
What was that? I'm sorry.
I did all the AEDs, checked all the AEDs,
Great.
and by not having the guy come do that from out of town, it saved. Well, just in his fees, $1,855 would have been more than that because he stayed the night every time he came and did it for 2 days, and I did it in 4 hours. So.
Well, we should let you spend the night in Custer County. Always.
Oh, thank you. It's a pleasure every night.
Yeah.
I'm sure.
Thank you.
All
Very
right,
good.
thank you.
I look wonderful.
Yeah.
You look different.
Jerry said it was his, he likes it, he wanted it.
Yep.
Yeah, that's what I was thinking. Miss Donna, Miss Gwen, could you guys tolerate us taking about a 5-minute break real quick?
Yes, because you'll be much happier.
We will
Well,
be.
be more patient, fire.
So I'm sorry I didn't make it to that meeting. That's okay. Good grief. I ended up my doctor called me like today at 1:30. I'm like, I can't hear it coming.
We'll come back to order. Our next item of business is Human Resource Finance. Donna, good morning.
Good morning. That was only 4 minutes, by the way.
4, good.
Picking up time.
There you go.
We're getting better.
I have nothing but the handwritten
Okay.
Yes.
Thank you for that report the other day for the handwrittens.
on there. Welcome.
Mr. Chris, you all right?
Doing great,
Got
thanks.
that under control?
Yeah,
Thanks.
just waiting for you.
Okay, let's visit sometime today too.
What was that?
I need to talk to you sometime.
For the record, that was Kelly.
Has the job posting window closed for VSO?
It has not. That will be the 13th at 4, and I have 2 applicants at this time.
Perfect.
And good luck picking. They are really stellar.
I love it.
Both stellar.
Great, he said there was pretty good ones.
Yeah,
Two
and boy, just wow.
Local?
Really, really.
Let me set up the interviews. We need to get the
Oh,
two local.
that's a.
We promised them that they would be part of the interview process, and I think it's integral for them to be.
And I wanted to know if that should be Bob Dreyer
Randy
and
Knight.
Randy Knight. Those were the only 2 I knew.
It's the only 2 I know, but I'm not
And then,
opposed to if
and then
other.
Roger
The new
Watkins.
guy at the meeting the other day. I don't remember his name.
It's not saying Randy when I'm signing a check because,
Oh, phew, close.
well, I had a little seizure right there on that first. If you look at it, you go, what's this?
Black Hills one.
Well, yeah, that's enough to make a guy go into a seizure for crying out loud. But when I said Randy, I wrote an R.
And you go, oh, no. But does that sound, that would be 7 people for the hiring committee? Or do you want more? I don't know.
You know,
No, that's what we talked about.
that's a lot of
I wouldn't get
people,
it
but
too many.
I think if we did what we've done in the
This is
past, write down questions and ask these folks also, write down questions like that so that we're consistent and maybe not have, maybe the 3 of us ask the questions that they've submitted and we could have dialogue, and then at the very end we could ask if they want to be, I just don't want to overwhelm a candidate with 25 people. It feels like attacking
On
me.
there. And I feel the same, if the same person asks the same question, it's delivered the same way. And
Right.
so it makes it, I think, even, Stephen. But I will ask Bob and Randy if they have any one thing that they would like to know. You know, if it's blah, blah, blah.
Perfect.
And that we
Got
could
it. We
integrate
don't know
that
what it is,
into
but
the
we have to.
questions
Right.
on
Good.
there.
I just don't want to inundate anybody, but I certainly don't want to leave any of our military out of the hiring process either.
Perfect. Okay, so I will be in contact with them. on that.
Thank you.
What else is new, Donna?
You know, just really nothing. When would we have the interviews, do you think?
Well, you said February 13th, correct?
Is the close of business. Both parties right now have already passed backgrounds
Right.
based on what their life is at this moment. So I don't need to do any of that part on those, you know, but I could have 5 more that I needed to do a little more in depth on those.
Let's say soon
Thank you.
after, maybe Friday the 16th, would that work?
Pardon me? The
Friday the
15th?
15th, I'm sorry. Just a thought.
Yeah, I will probably be out of
All
town.
right. Monday too?
Monday's a holiday,
Well, you're right.
so the 19th possibly, Tuesday.
Works for me.
Commissioner Kenda?
No. It's my wife's birthday.
Oh, heck to the no.
Well, then you'll
Good
bring the
job.
cake for us.
Yeah. So let's move it.
Wetmore meeting on the 20th,
That's be a good time to
in the
do.
afternoon of the 20th,
Sure.
2 o'clock. What do you think, Ms. Dawn?
Maybe let's start at
Well,
1. Is 1 okay?
if that-
Oh, that's true if you eat.
Wetmore.
Okay.
If that meeting runs long,
And if we have too many candidates that are worthy of an interview, we may have to go a second day or drop it, you know, even
We'll
5
see.
or 6 on there.
Well, we keep it, I mean, it's possible. Just keep it crisp and do the same questions.
We
You
could
can-
do
you're not gonna
4
gain-
at this way, but you know, you just never know what your turnout will be.
Right.
Okay. 2 o'clock on the 20th.
And I will let you know how it's going along. as
and
we
you'll
move forward.
contact those other,
Yes, I will ask them, make sure they're available first, and then I will contact the people that I have so far and ask and try to keep it
Good luck. Get all those people.
that
I
should,
know that's
time.
why
well,
we
it's
have
really
it.
only 2,
Right,
it's
and,
just 2 people. to
Oh,
oh,
contact.
what day is Roger?
He's here on Tuesdays and Wednesdays, so he'll be
Okay,
here.
perfect. Whew, I thought, oh, we're already,
Roger's integral, you know, but I really would like the other people's input.
What day did you say they closed the applications?
13th.
February 13th at 4.
So will you contact all those people, or?
Yes, I will visit with them and make sure that we're all on the same page before we get too far.
So Roger, Bob Dreyer, Randy Knight. Okay. And then I would guess, thinking out loud, we'd probably bring the new hire on March 1. Huh?
Okay. yeah.
So
I
what
was
time
trying
we
to think.
decide on
I
that?
believe both said March 1, based on the close date of February
And then
13th.
might give them some transition time with Roger.
And I believe one is employed and one is self-employed. So it might have to be moved out a week or so past that. But I don't think March 1st could be any sooner than March 1st.
Yeah, okay. All right, excellent.
What time we starting those interviews? I'm behind here.
2 o'clock.
2. Got it.
Once you get that in there, I'll have changed it because no one's available
And you, once you do get it solidified, you just
on
shoot
there.
us an
Yep,
email.
I will ship everyone and
Okay.
have us all on the same page.
Excellent, thank you. Anything else?
No,
Um,
I saw you just signed Art's check. So
Yes.
on there, you can have a coroner vehicle. Then we won't need it. So that's a good way to have it.
I'll throw out an account number and you remind me what we were dealing with at 208.
Repairs and maintenance.
What was coming out of there? What were we talking about?
Road and bridge, the
Oh, yeah.
the line,
Yeah,
and out of
yeah,
admin.
yeah.
Did Gary take that voucher with you? With him? With you? If you went home at your house?
Nice,
You gave it to me yesterday.
I did.
Yes, sir.
Because my understanding is I'll have a letter to attach with that. Perfect.
I have,
Oh. I didn't realize the voucher was on the back of it.
Yeah, I put the bill and the voucher.
I
had
noticed
no
it
idea.
last night.
Okay. Did not
Perfect.
know that.
Because I wanted your choice. So it's the 2875 98
Well,
Do you want to
with a
discuss this
letter.
now?
we're still in the process with that, but yeah, maybe we should just do it right now. Is that reasonable?
Sure.
I'm good with anything. Okay, based on just our conversation last night or yesterday, I put together a letter. I have no idea if this is the tone or the way you want it to be. It was more of
You jerks! What are you doing?
as much as I liked, I wanted to say you've got some heck of a nerve adding an administration fee.
Right,
So, but I'm happy to change. We can scratch. I'll start from scratch if you like.
My name on the bottom?
My name
I
on
was
there.
good until I saw it.
It was just the only reason I did
It's okay,
that.
Don.
I thought that about late. First thing I thought was, and I'll give you my rationale behind it. My first thought was, should the 3 commissioners, I mean, if we signed it, Tom Flower chair, we're talking about $345. I mean, is this something the chair needs to write this letter, or the chief financial officer should turn around and go, time out. We're not paying a ridiculous fee.
See,
mean,
I
that's
thought
kind of
Gary
my
Hyde
thinking.
because it's his money.
And I'm fine with Gary Hyde. Let's just change that to Gary Hyde.
Gary's okay.
Yeah.
But you are too.
My husband
And this
received a
may
check
not be
from
the tone you
CenturyLink.
want.
I just assume
I
have
just
it a
took my
no.
best shot. I
And
mean,
the
I
second
made my best shot. It was late at night after the Westcliff meeting, so.
on there.
I think it's good enough.
On there.
I like it, Jay.
Yeah, I do too. Until the second to the last.
It's in it. Yeah. And then they'll-
I can change mine to Gary.
And it's polite yet firm, and
Yeah,
it's a
on
good
there.
letter.
And you've not burnt any bridges if we have to pay the
Right,
admin after?
You're not
And-
screaming.
And that's why I said, do not hesitate to contact me the last line, because if you have, maybe we have an agreement with them that says we will pay this thing, and they go, excuse me, you've agreed to do this in the
Yeah.
past, and I would say, let's just pay it,
And
move
we
on.
would just do
And
a
Gary's
I
been
don't know.
communicating with him. Maybe it's right that he sent
sign
this
it.
letter.
Then it was, because it was at his end.
Sure.
And he has the dog in the fight because it's his
Yeah.
budget.
Well, and he knows that he's accepting responsibility. We screwed up or paying the bill, but we didn't get notice.
I admitted that,
Yeah, we're going to do it. So.
we're gonna fix it, we did it. I just don't like $345 for nothing.
Yeah, I certainly don't have any issues with the tenor of the letter. I mean, I like the first sentence. Full and final, this is it. I believe, and somebody certainly smarter than me can correct me in the back of the room, but I believe CenturyLink is one word with capital C, capital L.
Is that not what I did?
That's how I write it on here.
Yeah, it's
Okay.
capital
Yeah,
C,
okay.
capital L, so we
We
can
might
make
need to
that
change
correction.
the L to capital, if you wanna use this.
And then I would ask the commissioners, do you feel like a commissioner or commissioners need to sign this as an added hammer or not?
No.
That was a
Gotta
big
give them a
debate
chance
me.
to respond.
My
because
first,
then we hammer them.
It's kind of how I felt.
gotta
I
hold
kind
your
of
animal
felt,
back.
first I put your name, when I first wrote it, I put your name down as chair. And then I said, you know what, this is $345. I want to see, I don't want it to appear that we're being petty.
Well, and you gotta
Nickel and dime.
understand, we have a county government here and a county process, and we have people that are responsible for doing things. It's not always, everything doesn't bubble up to a
And
commissioner.
they may
to do
come
it.
back with
They
a
need to come
very
back.
legitimate
Then we
reason
can-
why we should pay it.
Sure, then we get
If that's the
involved.
case, we go, let's just pay it because it's the right thing to
Sure.
do. So
We gotta let
at this
people do
point,
their
we don't know
jobs.
that.
Right.
So I'm okay with Gary signing it, but I'll do it. I mean, any way you guys want it is fine with me.
Yeah, if this was just an invoice, I wouldn't have even asked the question. It's not an invoice, this is a claim.
It was a
filed
claim, it was
against
a
the county.
Yeah, I
Yeah,
agree.
they hyped it up once they
They
chose
should
that
have, if they
manner.
come in normally without that crap, and Gary says, oh yeah, we screwed up, and pay it. That was within his prerogative to do.
On there.
It was the right thing, but this is where it is. It's
Yeah,
good.
just different.
And then my second question is, should this letter go to CenturyLink or should this letter go to JNR?
Copy both.
If you look at, and I looked at this carefully. you know,
Yeah, that's why I thought you ought to
There's
probably take that with
multiple
you.
things here, and I appreciate you doing that. First of all, the remittance
Right.
goes to Seattle, Washington, but the claim is Monroe, Louisiana.
Right.
I felt we're
CenturyLink.
sending this to, it's both CenturyLink.
Right.
So my feeling was, let's send it to Monroe, because that's where the claim is.
Okay.
Yep.
And
Perfect. I thought Monroe was their billing in Seattle, so that answered my
yes,
question.
so that's why I did it that way. But
Exactly.
again,
They both
whatever you
need to
guys
get
want
that's
to do,
exactly
the
what I
office,
was-
both offices.
I was going to suggest that I thought we were dealing with the claims office.
And I put every number they had regarding. Just so that if they can't find it,
Yeah.
shame on
Right.
it.
I would move that we authorize signing the check for the $2,875.98 and including the letter as written by Commissioner Prince to go along with that check.
Second,
With,
as corrected.
with Gary Hyde as the signatory.
Gary Hyde is the signatory.
And changing CenturyLink to capital L's.
Right.
You are so good. The shining star.
Probably already done, right?
It is, it's already done.
A discussion? Hearing none, proceed to vote. All in favor say aye.
Aye.
Aye, opposed nay. Motion carries. We got that taken care of.
And I will take the letter over and I can have Gary sign this as well as that and then get it in process.
Let's see whatever we have.
So they're getting ready to print that on letterhead for you.
Okay, perfect.
Perfect, thank you, Ms. Donna.
All right,
Appreciate
thank
that.
you.
I think it's an appropriate way to go.
It is.
Okay. Always a battle of who's gonna go first. Motion to adjourn? Oh, no!
Next
Good
victim.
morning, how are you?
Good, how are you?
I'm good.
Good.
Nice to
Jennifer.
see you.
So I've been here a month.
Yeah, can you believe
Yeah,
it?
no.
January 2nd.
Is it what you
That's
expected?
amazing.
Yeah, about what it was. Yeah.
Is the weather what you expected?
Yeah, it's not.
All right.
Yeah, I imagine Creed had
Creed's a lot colder.
It gets colder up
Yeah,
there.
not as windy, but you know, colder.
Is it windy?
I was like,
Yeah.
really?
This has just been mild this year.
Yeah, right.
Yeah.
Brace yourself.
It only gets worse.
So your newsletter, did you mail that out or?
Not yet. I was
Okay.
talking to Diane about the best delivery method for that, so she has some email contacts,
Okay.
and yeah, just playing around with that. 4-H newsletter is also coming, so
Okay, good.
just wanted to tackle both adults and youth audiences. So there we go. So, any questions about my letter?
It looked good.
Okay, great. Tommy sent
Are you talking about the newsletter or your
Oh,
report?
either
Okay, I was
report
just
or letter.
Talking about our letter thing.
I was going over your newsletter again. I looked at it when we first got it, but
And it's nice to have one going on.
Okay, good.
I got it, I didn't review it, I apologize.
It's all about energy, so you know.
yeah.
I remember glancing at it, and I didn't realize it was yours. I thought it was just one of those.
That was another
sent
piece
to a
of
million
of
people.
literature.
I will be better in the future.
I can not
this is
include
my
it if
fault.
you
No,
guys
no.
Totally
don't
my fault.
want. Okay.
No, we're good. Yeah, maybe you could share with us the gun storage.
Oh, sure,
talked
yeah. So Shooting Sports has about 15 guns, air rifles, shotguns, pistols. All of those are for the Shooting Sports kids. And so those are stored downstairs in a safe in our extension little storage place down there, and we moved them in. I always get his Mike.
Yeah, it's Mike Halpin, no
Halpin.
R.
Okay.
Yeah.
I'll
Hairpin.
I know. I will take that R out. I even had his card and didn't. And he's aware those will go out separately. The Shooting Sports instructors will check them out for this season, so that's March to August, and then they'll be in charge of that. But I just wanted people to know if they saw cases going in and out, the ammo will be checked out separately, so there won't be any concern about that. And then we also have 12, I think, bows downstairs as well, but not as big of a concern, I don't think.
Are they all the same?
The bows?
Yeah.
Yeah, I think Outdoor Buddies donated them last year or the year before, so yeah, and then we, only Diana, I, and the instructors will have that code, so that's kind of a safety precaution for us.
I want to come back to that, but I also want to ask you, well, let me ask you this question because I think it pertains. So in your letter, you said you were signed up for instructor training in March.
Yep.
Instructor training for?
Shooting Sports.
Okay, wow.
Yeah.
Excellent.
Yeah.
Okay. And then secondly, the meat quality assurance, your third bullet MQA, March 5th. Do you have a time for that?
Yes, we just got that yesterday, so it's 5 to 7 at the Saddle Club.
Ah. Okay.
Uh-oh. That did not sound like that was a good time for you.
Yeah, I sat in a meeting the other day with the president of the Saddle Club, and we scheduled a meeting on Tuesday, March 5th at 6 o'clock
Oh.
to meet with their board of directors on a strategic plan. So you might contact
We got
George Coons.
Okay. Dorothy Nipa had confirmed that that's.
Okay, and she probably was not aware of this board meeting that we scheduled the other day, so maybe just follow up on that.
Okay.
But currently, you're scheduled on the 5th at 6 o'clock, or 5 to 7, you said?
Is
Are those
it-
on the website when they're finalized?
We just put them on Facebook. I did send them to Vernon to do the county update. Yeah. I've never been to the Saddle Club. Is there space to hold 2 congruent?
There's plenty of space, but the acoustics are not very good, so.
Okay.
And it doesn't mean we couldn't move that board meeting for the Saddle Club here or somewhere else
Okay.
too. So, do you have George's number?
I do.
Okay.
Yeah.
He is gonna be gone
Otherwise.
mostly between now and then, so I would
Okay.
recommend maybe you could try to get a hold of him today. He was in town yesterday.
He's leaving this afternoon.
He's leaving this
Okay.
afternoon.
I will call him as soon
Yeah,
as I get
because
out
he's
here.
going south,
All right.
way south. Yeah, so, and you might mention that, hey, I spoke to the commissioners, and I would be amenable to moving that board meeting wherever. I don't think it matters. If we needed to. Good. Okay, anything else, gentlemen?
Quick question, Tom, this is off the wall, but in the strategic planning meetings we've been having, part of it is, improving kids' sports and fairgrounds and event centers. How many acres does the county have for the fair out there, and how many acres are the Saddle Club own anything, and they lease the county?
Saddle Club owns almost all of it.
All of it, right?
Yeah.
So about how many?
County, I've got that map, but I would guess the county owns 2 or 3 acres at the most.
That's what I was
Saddle
thinking.
Club owns all the property. The county just leases
Oh, it's a
the
county lease.
buildings
Okay.
from the Saddle
Yeah,
Club.
and
That's only the
Technically
area that's the pigs and arena and I think it's or the sales
The barns,
barn.
yeah.
The reason I ask is because I've been asked a couple of those questions by fair board people, wondering how to plan. So it sounds like if the Saddle Club, if we're going to do any, it's not county owned, but it's private Saddle Club, we'd have to deal with how we include all the things that are out there, including the Saddle Club events and the rodeo and all that as part of the bigger picture when they're thinking about it.
Definitely, and as far as 4-H goes, we'd love to have one space where all the 4-H stuff
Sure.
can happen.
And that's stuff that you guys need to be talking about.
Yeah.
with everybody.
So the county owns everything south of this blue line.
Okay, so it's a
Including
strip.
this.
Oh, okay, I didn't
So
realize
the
they.
county
so they-
does own a little chunk of that.
Chunk of
south
that
the
up
border.
Oh, that's part of this there.
Yeah.
But basically where
Yes,
the
that's
buildings
Where the
are,
building.
yeah, yeah.
And this is Saddle Club owned buildings here where we're leasing that ground. Right, that would have to be part
No.
of
I
it.
thought
Those are
those
not
were,
Saddle Club,
I
those
was
are
gonna say, I
So the
thought
county
those were
goes this way
buildings.
too. huh? Okay.
No.
Well,
They just own the buildings, and they're
Correct.
leasing the ground
Oh, okay.
that the buildings are on. They have 100-year lease, I think, don't
Yeah, I
they?
know
Isn't
that.
that yeah.
All right. Okay, so that, yeah, that's good. Well, that's good to know. We've got a lot of room here to do things with if the saddle, if it gets, big deal with sporting stuff,
Yeah.
shooting your arrows and that kind of
Yeah.
archery.
Pretty exciting to come in when they're talking about all those upgrades and events
And
and
she
that
has
stuff.
this map here too, doesn't she?
I'll come down and get it for you. I don't have it.
Yeah, and you probably, did you get that from
I
TV
asked-
or
I
from
asked
Vernon?
Vernon to print that out
Yeah,
for
so
my
you can
meeting
plug
the
it
other
from
day.
Vernon, yeah.
I've been
That's
there
good
for
for
years
all
if you
your
want it.
thinking ahead stuff and,
Yeah.
and working with the Saddle Club and what they got planned.
And now that I think about it, we probably need to include you in that strategic.
I'd love to be a
Group,
part of that.
yeah.
Yeah.
Yeah, you ought to be going to that.
Yeah.
That February 5th will be the next meeting unless it gets changed.
February 5th was yesterday.
March.
Okay. They're all running.
Tom had
together.
5th on his mind. A 5th on his
strategic-
mind.
That's MQA, right? February or March 5th, yeah. So.
And that's that
strategic
simultaneous
plan.
meeting? Oh. I'm supposed to be trained on how to run MQA that day.
Yeah, no, I would suggest missing MQA.
Yeah,
That'll
yeah.
get you in trouble.
Okay.
Yeah, so I will try to remember to include you in that
Great, I would like that.
email string. And
Yeah, and if you guys have any other questions, I just have a few comments.
I do not.
Okay.
How we treating you?
Huh?
How we treating you?
Oh, good, good. I just gotta say, Diana's awesome. So
Good.
she's and Tom. Thanks for always checking in. Just appreciate that. Just one thing, March. I hope to have appointment list for you for the advisory committee.
Yeah.
We're looking at the bylaws where we have 5 people they're still within their term, so they agreed, yes, let's go forth with that. But we're still looking for some people. So if you guys have any ideas, I would really love that. I don't know very many people in town, so specifically a small business owner and then a community builder kind of person. So those are
Is Jake Shy already on your deal?
Jake Shy. No.
He's the guy that's working on the strategic planning, and he's kind of pushing hard on event centers,
Oh, great.
things for kids. He's a farm. He runs the feed store,
Okay, so
and
Alicia
he's a
is his wife.
rancher type.
Yeah, so those are just some people that we would like to fill specifically for those slots, and then some other people, because I think the bylaws allow for 9.
Okay.
So, yeah. And hopefully I'll have a list for you in March. But if you guys are comfortable, those 5, I would just like to get started, and then we can appoint people throughout the year as they become available.
Yeah, I spoke to Mary Gump yesterday. Very pleased with having met you, and
Yeah.
yeah, she
Good.
was-
Yeah, she
spoke
seemed like
very
a.
highly of you.
Oh,
So,
she seemed nice.
yeah, she's
Yeah.
a great gal.
Thank you.
Perfect timing, Shannon.
Okay.
So, yeah, the Shies certainly have been involved in 4-H. And
Yeah.
he's a business owner as well,
Great.
so that might be
A good match.
So this is a perfect time for me to bring this up, since we're talking about Shies. Last night, Brent Bruiser donated to the town of West Cliff a Bill Gillette photograph. Absolutely fantastic. It's sepia, kind of brown. And it's a picture of a horseman, a fellow on a horse and then some cattle in the background. Gorgeous. And it happened to be Jake Shies
Oh.
was on the horse. So,
Oh.
He's a roper competitor.
so that
That's
was
what I've
my
heard,
way
yeah.
of saying.
Great, that's perfect.
So yeah, it was wonderful.
Donated that for your new
For the new
digs.
building.
Great.
It was really nice. And
Yeah,
Jake's a nice young man.
great.
Yeah.
Yeah.
He's on the school board too,
Oh,
so he
okay.
knows the kids.
Yeah, he's a good guy.
So in terms of this report, is there anything else you guys want to see? Is this pretty good? Okay.
No, I think that looks good.
Don't get frustrated. Come talk to us if you have any issues.
Okay.
We
I
had different
appreciate that.
weeds than what you had in Crete.
Yeah, not black henbane here, which is nice, but there's a lot of mullein. So yeah,
We're glad you're here.
yeah. Thank you. I appreciate it. Thank you, gentlemen.
Okay, thank you, ma'am.
I'm gonna start this way.
There you go.
Move
We'll
that
go down
way.
the line.
Yeah.
Huh?
Thank you.
See you. Nice handshake.
Hey, thanks. Somebody told me that's a good.
Yeah.
Yes, it is.
That's right.
And you looked us in the eye, and that matters too.
Yeah. See you guys.
Okay, we'll move on. Unfinished business? Apparently not. I do not. Commissioner Canada? Okay. New business? Discussion of the medical care over in the jail facilities. Welcome, sir. Timing's impeccable.
Good morning.
She missed all the excitement earlier, but that's fine.
Yeah.
How are you?
I'm Miss Camper. How are you?
I'm good, how are you?
Yeah, that's what I was thinking.
Am I coming up?
Sure.
We're missing one county attorney, whether or
Yeah.
not you.
I'll sit over here and I'll let
Yep.
Miss
perfect.
Mrs. Livingood, I'm sorry.
Yeah, Clint's had some shortness of breath, been a couple days in the hospital for testing. They're pretty confident it's not a heart attack, so he was not able to be here
I
yesterday.
had not heard that, so
neither.
that's good to know because I was going to talk to him about a couple emails I received today
Yeah,
from
no
our
kidding.
friend.
Just
He's out.
he's all over that, but he may not be doing anything today.
He's out of circulation.
Hours. Yeah, so
Apparently, we need to have a discussion.
So what's up?
So appreciate you pushing us to the back of the meeting here. I had another meeting this morning. So I wanted to talk a little bit, and Chris is here as well, and I want to ask Elisa to come as well so we could give a well-rounded discussion on this. So we're having some challenges. We've recognized for some time that we needed to have some, and I would ask either Lisa or Chris to jump in wherever they think needed. But for some time now, we've looked at and recognized that we need to have some type of professional medical services in the jail. Due to several reasons. Hopefully a lot of those are just self-explanatory, but from in processing, typically, when someone comes into the jail, they're in processed, and part of that is a medical evaluation.
Exam or something.
And I'm not talking comprehensive, the annual checkup, the whole deal. I'm not talking about that. But I'm talking about an evaluation to review if that inmate is on any prescription medications. Are they supposed to be on any prescription medications?
Are they contagious?
Any special needs, any of those type of things.
Right. Are they safe to be here?
Yeah, are they, right. A good evaluation by someone that's certified, not just not certifiable, meaning a jailer
Hey,
or,
it could be both.
myself, or, you're right.
Not full time or?
So no, not full time, and I'll get to that. So we explored some different options. Chris and I met with NatCor about a year and a half ago. Daniel and one of his nurses, they came up and they did a presentation and they presented us with an offer. And I believe then that was 16 hours a week, which was a little more than we thought we needed, but we were starting there, and I mean that figure came back at like $72,000 a year, which was not feasible. Exactly, was not
That was
feasible.
part-time, huh?
Part-time.
16
Yes,
hours a week.
part-time.
Wasn't even
Yeah.
half time.
So
I know, right? Sign me up.
So then,
You're gonna need a new public health director.
yeah. I'll go back to school. then Chris and I met with Elisa, and this was a while back, to talk about maybe some part-time to supplement in with her public nurse duties. Some counties around the state do utilize the public health nurse in that capacity on a part-time basis as well, just to fill in. And so then what really brought this to fruition, hopefully this is appropriate in here. So we had, if you're not aware, we have all of our jail staff are QMAP certified, which basically trains them on dispensing medications and doing some of those routine things that happen on a daily basis in the jail.
A QMAP is a qualified medication administration personnel. So
Awesome.
they just,
There you go.
yeah.
And so we just recently sent a couple of our jail staff that hadn't been through it yet to the class and came back, and one of our jail staff shared some concerns and wasn't willing to follow some procedures and protocols that we had in place because as much as we tried to avoid it, some of it was in contradiction to some DEA regulations and so forth, because quite frankly none of our jail staff are doctors or are certified to administer medications, and we don't have any options. I mean, if we certainly don't want to face a lawsuit because we're not providing medical service.
Or you're doing
So you get where I'm going with this, right? So I mean, I'm stuck in this quandary because, quite frankly, if I send a memo out and say, listen, I understand that this is in violation of the DEA, but you're going to do it anyways, and then that person were to report us to the DEA, we could be in a slew of trouble far beyond
Not giving somebody their
where
medicine.
we're sitting here today, right? Right. So now I'm caught between a rock and a hard spot. So
what are your options?
I went back and talked to Elisa, and that's what we're going to propose here. So, and you jump in where do you want to.
Before you do that, did you talk to the clinic people to see if they'd volunteer through temporarily or anything like that? Like the docs.
No, I like that though. That's pretty funny. Do you do stand up?
Right.
In the evenings, or is this just a daily thing?
What kind of qualification
you
are you
do it?
talking about?
So
Does that have to be a nurse?
has to be at least a nurse.
Okay.
At least a nurse. And not an LPN either, but a registered nurse, because they have to be able to administer meds.
And to do the assessment, the
RN.
intake assessment has to be done by an RN.
Yeah.
Yeah. So.
How thorough is this intake assessment?
So it's, and I'm just speaking from my experience from when I worked at the prison, but it's really just going over, kind of just how are you feeling today? Do you have any complaints? What medications have you taken in the past? What are your diagnosis?
You're not asking us personally, right? Because I want to tell you.
Well, I feel like you should probably withhold that information for now.
Especially since we're broadcasting into
Yes,
the world.
exactly.
And then it would just be my job or the nurse's job, I guess I should say, to ensure that we have the medication that they're prescribed, or if we don't, that we can get it within a reasonable amount of time. And then also, if we get somebody up here that is, end stage COPD or even stage 2 or above, I would say COPD, they can't be in this elevation, which is something that we dealt with last week. And so this isn't an appropriate place. They'll have to find some
Diabetes and all that kind of thing.
Yeah, and just to, to make sure that they understand the fact, because sometimes it's better, well, maybe not better received, but at least better understood, coming from a nurse, that you're not going to get Benadryl
Right.
4 times a day so you can sleep through this incarceration. Like, it's, yeah.
And you would be surprised.
Yeah.
They demand Benadryl. I mean, they do. They want it 4 times a day if you give it.
And we need to set protocols for that exactly, so that we can just fall back and say.
And we have some in place, but they've been kind of set by Chris. And
So in fairness, we have that questionnaire that asks them the same question she's talking about. The problem is the jail staff they don't have medical degrees. So whatever the inmate says, they just write down, and we're in that quandary where I think our biggest issue is assessment, one, but two is the medication consistency. We're not currently passing out any controlled substances, but yet we're still passing out medication that clearly, if a jail staff made a mistake on passing out meds, we could have a serious problem in there. Knock on wood, we haven't so far, but I hate to test the water.
So what's the proposal?
I'm sorry.
Next step.
What's your proposal? What do you think?
So in talking with Elisa, so right now she's 32 hours a week at Public Health. Not that she works 32 hours a week, but that's what she's paid is 32 hours a week. Meaning she works more than 32.
Thank you.
Meaning that she,
there?
no, yeah, I didn't mean that she didn't work 32. Sorry.
Or is she trying to fill
like
in?
so many of us on salary, we find ourselves there long after the workday. So I know she works more than 32 hours a week already, but I went to her and proposed, what if Chris and I and the jail staff think that 8 hours a week would be appropriate, and visiting with Elisa, we thought 8 hours a week would be appropriate in the jail.
Okay, can I ask a question
because-
about that specifically?
Yes.
Okay. Do you have to do this when the prisoner initially arrives? I mean, let's say
That's a great
you
question.
arrest somebody at midnight.
Yeah, we're going to get to that.
Okay,
That-
all right.
That was
Because
part
I
of-
wondered
that was part
about
of
8
my
hours a week. Is
How
it
do you do
as
it, right?
on call as
It-
needed?
That's exactly right.
Okay.
So 8 hours a week would be.
Well, I'm impatient.
So we're saying 8 hours a week on average, right? Because some weeks in the jail it's going to be slower, and we're not going to have any intakes, and we're not going to have much review. And then other weeks, we have a lot, right? And so on average, we're figuring about 8 hours a week, and basically that's going to be on call with probably a couple hours a week when she would come in and just review everybody's file and make sure that everybody's getting what they're supposed to. Any concerns that the jail staff may have. If we arrest somebody at 1 a.m. on a Saturday, no, we'll just set a protocol in place where, at 8 o'clock, then that following morning we would call and leave her a message, say, hey, we got somebody in last night. We've already in-processed them. When you can get in, can you come in and review their chart? And then we would just work through those protocols so that, her life isn't completely consumed by the jail.
There is some statute about that I found that, so we have 24 hours from the time they're booked until they have to be
All right, that
screened.
answers my question.
So-
Thank you.
So essentially it would be PRN as needed. Again, we would have to navigate through a few requirements.
So budget-wise, is it about $600 a month?
So I don't know what Elisa's salary is and what her hourly rate is, because I don't think that's. I mean, it's something that we would get into more. I wanted to come to you to see if this is something that you think we could possibly fund. Elisa could give you a better idea on what she believes that would cost.
Yeah, we're going to need to know that.
Absolutely.
Is this related to your PRN administrative person that you were asking about earlier? Totally
It'd be
separate.
more trained. Huh?
Just want to make
Wouldn't
sure.
have enough training.
No, because that would be just a lay person with
Here's
no.
where my mind was going. Hours a day. If you'd be out more than you normally are because you're taking care of jail duties, would your PRN admin person be able to fill in some of the things that you routinely do because now you're out doing it for the jail?
I was going in a different direction. Sorry. Yeah.
Not really, because everything that I do is, I don't know, for lack of a better word, like at the 3,000 foot level or above, and this is like the 1,000 foot
Got it.
and below that I need to hire for. Does that make sense? So everything that I do is either making decisions or meetings,
You're the professional.
that kind of
The other
stuff.
person is an admin person. I
Exactly.
fully get that.
Yeah, not that they're not qualified to, do what I do, but
Well, I'll jump in and say conceptually I really like the idea.
Hey, need it.
I'm always concerned about jailers who are not medically trained having being thrust into this medical position, I believe there is liability there, and I agree with that question. So I think a professional do it makes sense.
One other thing I think that we can add as a win for this too is if they're, if an inmate is saying I'm having chest pain or I have belly pain or whatever their complaint is, right now we're just calling the EMS.
Right.
Well, if I'm on staff, I can come and say, okay, have a Tums.
Right.
You're gonna be fine. Or
It is
this looks like a bowel obstruction and we need to get you down the hill. Versus just stop it.
But you're right.
Yes, absolutely, absolutely.
Yeah, I was
so,
gonna
and I'm not sure, I think that those bills are mostly passed on to the inmate, am I right? I don't know that the county pays.
That's, the county's gonna have to start picking up some of that because EMS said that they're not gonna eat that anymore.
Right. So we're looking at more.
We are gonna have an increase. I mean, if we just look at 8 hours a week, right, that's 416 hours a year. So I did some preliminary numbers, and we had kind of ventured around like $30 an hour, because that's roughly
close,
what she's making as the county health person. So that's about $12,500 a year. Is what that would cost us. I do think that we would realize some cost savings because she could come in and deal with the, I'm having a stroke or I'm having a heart attack, when really they're just hyperventilating because they sat in their cell and until they hyperventilated, or they want meds.
Over the counter.
And so she can counteract some of that. We wouldn't have to call EMS for as many calls. Not that we don't have to, that it would eliminate it completely, but
Right, because you're still gonna,
There's
call
some
if it's an
legitimate
emergency.
ones gonna happen.
Exactly.
Absolutely.
Exactly.
Is this money in your budget?
so maybe. So, I mean, it depends on, the true cost I don't know, because I don't know how benefits and retirement, all that will play into that figure, because she's already getting those through the public health arena. So I don't, you see what I'm saying? I think Donna's going to have to come into that, because I don't know ultimately how much would come out of my budget. At 12.5 right now, probably I could make that work, because we do have some salary savings. So yes, I think we could. As long as that number doesn't get closer to 20,000.
The additional county cost would then be the benefits. I don't want to say benefits, the additional expenses that a county would incur by having an employee, if there are even any more.
Yeah, see, again.
I mean, I'm not sure there would even be additional ones, and maybe, should we ask, could you help us, or should we ask Donna to join us?
We can ask Donna to come over. I think, like you're looking at Medicare and Social Security.
Go ahead and ask her.
Yeah, would you please, thank you.
Right, because some of those numbers will come up because salary comes up. But also, I mean, to be completely forthright, so I approached Elisa about that because I knew she was only at 32 hours a week, and so, I mean, she's doing, a really good job for the county, and so this also helps her out too from an income standpoint as well by adding that additional 8 hours a week.
Yeah.
So, I mean, it's a win for her, I believe.
Yeah, absolutely.
It's a win for us.
So let me ask a question. I know you never worked a 32-hour week since you've been here. I know that you do 10 times, far exceed that.
Like 35
that,
at least.
At
The
least.
entire county is grateful.
Pretty
Okay.
great.
That being said, though, considering the workload you have now, could we fit in an additional 8 hours in the jail?
Yes.
Okay.
Yes.
That's fine. You don't even have to
And
explain.
especially when we just do
You
it
tell
kind
me
of
you
per
can,
diem, I
you
mean,
can.
as needed, whatever. It's not like I'm gonna have to clock in 8 hours every Friday.
What's the trend on the arrests? Is more of them at night, late, or in the morning, or does it vary equally?
Yeah, it just
You never
varies.
know.
I don't think we could really
Wondering
say.
if she's
that
going to
it's-
have to count on jumping out of bed a lot.
No, we won't be doing that because we do have a 24-hour window, so we
You
will
can
not
bring her
be.
in the morning.
The only time we would is if we had a true critical situation.
Emergency.
That
In which
and
call
maybe
EMS
an
anyways.
EMS was gone and we couldn't get a second call for something. It would be a very rare situation.
Yeah.
So who would you use like when she's on vacation?
That's a really good question.
That's a great question that we would just visit with Elise about. Maybe she would have somebody that could
Hold the crime.
Maybe it could be run. I don't
Right,
know.
yeah.
Don't
But-
arrest anybody.
Don't arrest
during
anybody during that time.
Right. I think we could probably get that.
Or utilize the
Donna
EMS if you had to.
No,
Yeah.
she said she would have to calculate it and call.
So there is some
She'd have to
deal.
what? I'm sorry.
Calculate it
Oh, okay.
and let us know. So.
I can't imagine it'd be significant. I mean, I just can't imagine.
I don't think it'd be $6,000. I mean, yeah, it'd be
Yeah.
$1,000 maybe.
Unless there's a minimum of some kind.
Which, you know, let's just say for argument's sake it's $1,500, so that bumps it to $1,400. I think I have that in my budget to make that work. Absolutely.
The only issue would be if you had some kind of thing that would push your budget, then we'd have to talk about, you didn't have the reserve that you didn't.
Right.
So that's okay.
That's right.
I really appreciate you bringing this to us, because this is a very significant thing, I think. I think that if we have a jailer make a misdiagnosis, you know, somebody's going, I have serious chest pains, and, you know, you're thinking they just want Benadryl to sleep better, and in fact, they are having a heart attack, and we do nothing. My goodness, what
All right.
liability could we
Well, and
have?
that's why you end up erring on caution, and then you end up paying for an ambulance
EMS
ride
ambulance ride.
to Parkview.
For
And,
Thompson.
right, because they have guests.
I get it.
Right.
And we've done that
I've done
twice. We've had
You talked to
we've
us
transported
about it not
twice,
long ago,
and
yeah.
and come to find out he was just seeking meds.
The inmates a tour of the county.
Oh,
Right. Get jail free for the evening.
And that specific inmate had told us when he came in there looking, well, he didn't tell the jail staff, but he told one of the other inmates, and of course we can hear them. He said, I'm going to do whatever I can to get out of here. I'll fake whatever I can. And he did. And
he did.
And you can't risk not taking somebody, though, because he cores out, then
Right.
Chris get in a lot of trouble.
So,
I'm not going to prison.
is this,
Not on that side.
Not on that side.
are you talking about a salary position based on your estimate of 8 hours? Or is this an hourly, 8-hour a week,
8-hour
no
part-time.
question about it?
I think we do the salary based on 8 hours a week.
And if it's
Because
20
again,
hours
it's
in a
gonna vary.
bad week over the 4th of July, she just
I'll just eat it
absorbs that.
because
Right.
I did 2 hours a week before.
Because and as long as she's amicable to that, I believe we can make that
Works
work. Because
best.
again, we will have protocols in place. We're not going to be calling her because somebody says, "Oh, you know, I have a headache."
Right.
I'm in favor of this. I don't know if you want to vote, or you just want to talk, or what. This makes sense.
Sounds like if it's in his budget and you're handling it, and it's the right thing to do. I don't. you
It's
can
going to be a
fight
small
consensus.
expense to the county, because we're going to have to pick up the additional FICA and those.
So we
kinds
want to
of
look at
things.
that price before you make a motion, or do
It
you?
probably makes sense to
Yeah.
look beforehand, but I would say
But
we'll
if,
be able to vote on it by the next.
If we want to wait, and then maybe at the next
Let's do the
commissioners
Wetmore
meeting,
Next meeting.
we'll have all the data together by then too.
And a plan
So,
proposal.
so we've put together a position description, but I've got to go in and just change a bunch of. We're using. We borrowed one from the Chaffey County, but we're gonna.
Okay. Now, my assumption is that most jails have a medical professional to do this. Is that correct?
That's correct.
We're really behind the 8 ball.
Well, so, but not fully, not full time, full staff. The larger jails,
Same
absolutely.
kind of thing we're doing now.
Same kind of thing.
Bet Fremont County does
Yes.
not.
Oh yeah, Fremont County has.
They have that core.
I thought they
They
had
have NatCore, and they have, I think, during the day, they have 2 or 3 full-time nurses that are there all day.
Full-timers, really?
Yep, and then they go home in the evening, like 9 or 10 o'clock, and then they're back at 6 in the morning.
They're also on
But one's on call all the time.
Right. I know that.
Yeah, they have 16-hour coverage, and then somebody's on
16,
call.
okay.
Correct.
But they're paying a lot.
I know that.
Oh yeah, they pay
Well, they'd have to.
several $100,000 a year for
Jeez.
medical.
What do you call this position?
So, so detention staff nurse,
So
unless we decide on something different, but that's kind of what we thought we would call it.
would this be a new position with a new job description, or just an
Yes.
addition to the job description that you currently have?
I think we should make it its own thing, because what happens if I get hit by a bus and the next person that comes in doesn't want to do it?
You get hit by a bus, girl, you're in trouble. I'm coming in.
Detention staff nurse.
If it's a separate position, do you have to advertise it? Or can you automatically just move her into it?
I think a county nurse, I don't know, that's a good question.
Good question.
That is a good question.
Yeah, I guess it would be something we'd have to ask council about, but
Advertise for 8-hour position.
yeah, it is.
Right, that's
certainly
a valid question. Yeah.
I personally would feel like we could do this in-house. Extending her hours is what we're doing.
That's
Not really hiring anybody.
That's why I asked the question, is this an extension of the position that we have?
Yeah, I wouldn't
Or is
change
this
the
another
position.
position that we're going
county
to
nurse.
put all this in? And if it's extension, I agree with you, we'd do right this second if we chose to. If not,
You just
I think
write
Jackie
it.
has a valid question.
Right,
somebody
an
could
additional
say
piece of a
It was
job
preferential
description.
treatment, and they didn't even
That's
give me a
right.
chance to apply for it, and Mark Howard would put his 2 cents worth in.
But I think if you keep it the county nurse position, and all you're doing is increasing the scope.
But that's not what they're recommending, that's why I
I know,
asked
that's
that
why
question.
you got to rewrite
Well,
and figure
because
out.
I hadn't
I don't
thought
know.
about that point, but that is a great point.
I don't know. I mean, what are your thoughts on that?
Well, I think if
My thought would
You
be,
could
I don't
have-
know why we haven't done it before.
Well, yeah, but we're fixing it now. Here's my thought. My thought is, I like them separate, bifurcated. And the reason is, if
Different
you
pots.
decide to move off to Hawaii with your husband, okay? And we have to hire someone, and they may say, I don't mess with jail people, but they would be a perfect, I mean, I like the idea of
Right,
having it
that's-
separate.
that was my thought.
Although it makes sense to have the same person do both, I mean, it just makes sense, but I like the idea of having 2 positions, and if it takes another, advertising and going through the process, I mean, maybe that's what we
Yeah.
ought to do.
Yeah, I think so too, if it's,
Donna and saying,
I agree with everything you just said. I think it should be separate as well, for a couple reasons, and I think prudence would call us maybe to
okay,
consider posting that. That being said, I don't know of too many nurses that live in this county or anywhere near this county that would probably jump all over an 8-hour,
We don't know.
but that's not for us to decide.
Right, right. And if you find somebody better than me, by all means. I mean,
for 8 hours.
yeah.
So I'd say let's bring Donna into the fold too and let her help us figure
so
out.
then if we were to do it as a separate,
That'd be a
then
separate, part-time.
as an 8-time a week deal, then then there won't be any benefits included with
Right.
that.
That's right.
Correct.
What do other
right
counties
out
do, Shannon?
And that is
there a
right.
public health nurse that has double
So
duty?
some of them do
So
use
they-
the public health
right.
nurse, like Alamosa County, for example. Their public health nurses,
And that's a
they
simple
work
solution.
right. They work right in the jail.
Probably part of their job description.
Yeah, they have their own
and
office
that's
right
why
there.
I'm saying that would be the way I would see the simplest way to handle this.
If we were, to Bill's point, if we were just extending her hours.
Right.
I
Already
think
has
the commission could
benefits.
sit right here and do that, if it's an extension of her public health hours.
And with an additional.
The one line that says, see the jail.
Yeah,
And when you
fulfill.
build your new facility, you put her office in.
Right, that's where she could
Well,
have
I
an
mean-
office or not. But I think that's the simple
there's
answer,
that.
personally. This is not new.
8 hours, probably not gonna get it eventually, but
Yeah, if you built me an
Eventually.
office in there, then we could not have to pay $1,000.
Yeah,
Unless
We just
to
paid
the-
$1 million for the office.
I'm saying in the jail, when they build a new jail,
Yeah.
if they make me a little room, then.
And that really is
We
probably
have a
not
room in
bad
the
I
idea.
mean, if you did, just playing devil's advocate now, if you were to combine it, so agreeing with what you're saying that you know, you're gonna have some applicants that maybe wanna be a public health nurse, but they don't wanna spend time in the jail,
For the
but,
right applicant.
but if it's combined, then
It's the job, it's the
That
job.
job they apply
it's part of
for.
the job
Part of the job.
requirement, so you
You can
will
always
vet that out.
bifurcate it later.
If you had to.
If you had to, you
Yeah,
could.
if you had to.
Yeah, I mean, if you had somebody that was like, I am not going in the jail.
I like the
You're not
fact
gonna
of
have the
combining
job.
it because then it's a full-time county employee working 40 hours a week. She gets all the benefits that go with 40 hours a week, the
Cheaper
increased salary,
price.
all of those things. It just strengthens her job description or her pay
Getting
and
benefits
everything.
now,
It's just
right, at
more.
32 hours.
But,
I'm
Yeah.
considered full-time.
So it
No.
wouldn't, the benefits wouldn't change.
No.
no, but here's what would change though. If the sheriff's budget was gonna pay for the additional 8 hours, if we just expand the position, then it's not the sheriff's budget paying it, then it's gonna be county budget paying it. You know what I'm saying?
True.
But I would be willing, I mean, and again, Donna could
Like a
address that
transfer
better
over
than
there
I.
to add that.
Some way to transfer from one line item that I have to that line item, you know,
Absolutely, that could be done.
just to do an adjustment.
That
Sure.
could be done,
They
yeah.
have a
I would
number
think.
from Donna. 14,600.
So that's the end of that.
14,600.
14,600.
14,600, so it's about a $2,000.
Now, can you ask her to hold on just a second? So that's if it's a separated position. So if we extended her hours as a public health nurse, other than the salary itself, there's nothing
So
else.
that would be a separate position, but what
I
if
think
they
that's correct.
combined it?
Right,
my
it would just
thinking.
be the hours.
Right.
Well, no,
Just-
no.
There'll be a little bit because Social
Transfer
Security
from
would
the
just-
sheriff's office
FICA
to.
would
And it
go
Well,
up.
true,
and it
but
would be from the sheriff's office.
Yeah, okay, yeah, you're
Smaller
right.
Health
percentage.
insurance would not.
No,
and
health insurance.
The rest of that would not, because you're still a full-time employee, so it probably
And it
just,
would be all general fund anyways, so. that
So
you
we can do it
pick
easy.
Whatever way.
Okay, thank you.
Okay, thanks.
We'll
Do you
put a
wanna
proposal
think on
together
this a
and
little
come
bit?
back to us.
About
With that
expanding
in
it? I mean,
I'm sorry.
Do you want to, sorry, go ahead, Bill.
That's okay, go ahead, Tom. I was just gonna tell him. Same thing Tom was just gonna say, go back, think about it, put what we've discussed as one position. You're gonna transfer money over to her
Okay,
and leave her position alone, benefits.
okay.
Yeah, and we could even just put my hours, like the way I do my hours, I could just put jail nursing
8 hours.
in our thing,
Right.
and then that line item just comes out of your, so I still only just get one paycheck.
Right.
Right,
Yeah.
that's right.
And
I think
I
that's
just
cleaner.
put my hours, just like I do,
Sure.
you know, OPPI or EPR or whatever, all the different things that I do, it would just be one more
Okay.
line item in there. It'd be really easier, actually.
All the drugs.
I'm not gonna say it. Look what I'm thinking, I will not say it.
Would you be comfortable with coming back on February 20th?
February 20th, I think I'm,
It's in Wetmore.
No, he doesn't wanna go to Wetmore. He's gonna tell
oh yeah,
us.
Let me ask this question, is there a?
Yeah,
is
that's
there a-
fine.
He's got cop cars.
Is there a dire need to do this sooner than that?
I mean, we've been doing it like this since the creation of the jail, so I think we can make it another 2 weeks.
Okay, that's fine, because if not, we would do something different.
No, I would rather get it right than try to rush into
I
it.
appreciate that a lot.
So let's, yeah, and by then, we'll work together, between the three of us, we'll have a good
And Donna-
position
get
description,
Donna
we'll get
involved.
Don involved in it. We'll have firm numbers and we'll make that happen.
And in fairness, it took us 4 years really to get to where we are now with mental health treatment. 4 years
Oh, yeah.
in the making until we finally
That's crazy.
have something that we can play with. It
It
just
just
takes a
takes
long time.
time. Because it's
You're the only one
expensive.
who got it.
Everything is expensive.
Of course it is.
Ms. Meredith, we on the agenda for the 20th. Detention staff.
It already has it done.
Okay.
Yeah, the cycle begins in February.
And the good news is, you have our support for this.
Perfect. Okay.
That's
Good.
not an
So,
issue.
I also just got a phone call that said we can get all the Narcan we want.
see, she already saved us money.
What is that? What is that?
Narcan, that's the
Oh, so
opioid overdose.
Yeah, for $0.
The family that makes $8 billion a year selling opioids or something, I heard on the news.
Good for them.
Well, you know, your immunization thing, I just was reading an article, I was waiting for this, $35 million in Colorado alone
So you're
spent
aware too, I
on
just applied for the
preventable diseases. No,
And
preventable
I want to
diseases.
talk about that before you leave while we're
Okay.
still on record.
Thanks,
Thank you,
Liz.
sir.
Thank you.
Thank you, ma'am. Appreciate it. I've asked
Later, Shannon.
Thanks.
Mr. Barr to give us a quick update on the black and gray marijuana grant. So if you would do that, sir, appreciate it.
You want me up here?
You're welcome to, yes. Apparently two reports, actually.
Keep shaking, we'll just keep doing it.
Yeah.
What has happened and what's getting ready to happen.
So we have applied for the black and gray marijuana grant.
What does that mean?
So it's a grant that they put out. It's really designed to people that work, and it really goes to rural counties. They get it more often than bigger counties because we deal with a lot of marijuana grows. And so in the past, it had been that we had to actually set what we'd done with marijuana grows and prove what we were spending that money for. And so to date, we've gotten about $17,000. We just got a $12,000 grant come in for black and gray.
From who's funding that grant?
DOLA. DOLA is funding those grants. And so we've applied for it every year, but it runs 2 or 3 times a year. So I just got $12,332, and then a couple weeks after that, I got notified that I was getting another $1,260 or $1,270. And then a week after that, I get the notification from the state that the gray and black marijuana grant's opening again.
Jeez.
And so now you don't really have to prove that you've had these incursions into marijuana grows. You just basically send in the grant, and DOLA decides how much they're going to award us, which is how we got the $12,332.
Probably based on the trend you've had in the past. Huh?
It's based on that. I think it's based on population. I think they're trying to push more of it into rural counties. And because they understand rural counties don't have the budget to do those kind of big operations. And so
We're being the most adversely affected by the illegal marijuana because we don't have the resources. So it comes directly out of the agency.
So it's going to help us buy some supplies. We obviously need like a Connex and other Connex to store evidence and those kind of things. But that's kind of where we're at now, and we'll wait and see a couple more weeks to see if we get that. As far as that grant goes, and I know I heard Cindy talk this morning. We are working on a JAG grant for radios. We're kind of got our quote from Motorola, but we weren't exactly satisfied with that.
That's what she said.
And we'll see what Kenwood does for us.
Each is a lot.
Okay.
Kenwood come back a lot cheaper.
A lot cheaper, about $80,000 cheaper.
Jack's got a question back.
Go ahead.
Didn't at budget time, or maybe I just don't remember.
Fell asleep in your chair.
Didn't you say that you were going to get some Kenwoods?
You discussed
So
Kenwood.
we definitely
And
discussed
you
that
put
we.
that in at a number as this is.
Yes.
Yeah. And
It's
do
this
you
many
decide-
Motorola or this many Kenwoods.
Yeah, and did you change that or?
We haven't pulled the trigger on that yet, Jackie, because we're trying to, there's a JAG grant where it might help us, if not completely pay for all the, so we wouldn't have to use that
I was
money in the
just
budget.
curious.
Yeah, and I wonder too, is there any, are the strings attached to that black and gray marijuana grant for its use? Is it directly towards offsetting cost
It's
of?
supposed to.
It's supposed to be, but I mean, really all it takes is our ability to articulate. I mean, if we were able to articulate that we need radios, I guess, to do marijuana grows, we could certainly do that.
But we have needs, I mean, we have some needs though, so understand that black and gray marijuana, right? So that money comes from the tax revenues that are generated through marijuana sales in the state. That's where, I mean, that's not taxpayer dollars coming out of like a general fund or something. That's how these grants are funded. But I mean, we absolutely need a Connex to store that stuff, but we also need to get some protective suits, and we need to get a couple respirators so that we don't have a problem like we did last time. So I mean, we're going to be able to justify, and rightly so, we should be spending that towards
overtime.
Those specific, right?
Could that be
That too.
used for overtime?
Yeah, That's what it goes for.
Yep.
That type of stuff.
Okay.
Yeah.
Thinking down the road here a little bit, Connexes, we've got one now. We have this pending fence project coming. Would those Connexes need to be on or very near or close to the sheriff's office? Could they go somewhere else?
Well, they need to be somewhere where we can make sure nobody can break into them.
So all we gotta do is bust a lock off of them.
And they're, right. I would like to see them behind
Inside that fence, okay.
Because it's evidentiary,
Right.
Right.
so.
And are you by statute required to keep that inventory for a certain amount of time? Obviously until the case is closed, but what about after that?
No, to
You
just till the case
dispense
is closed and the district attorney rules that we can get rid of.
Go burn it somewhere.
Or sell it.
Well, like right now, we have all kinds of
Yeah,
stuff.
right. Get back to the state. They're selling it.
It's just,
Yeah,
Some of those lights are hide all.
Just lights, grow stuff. Marijuana is destroyed, right, after.
Yes.
right, we try, our practice is to destroy the marijuana and not keep it. A lot of counties do keep it. I've said no, we don't have, the Supreme Court was very clear that we do not have to hold on to that.
A lot of liability holding
So
that.
we will get rid of it until somebody says we can't.
Because it's been documented, I mean, you know.
Right, that's right. Case law is in place, so
Right.
we're protected.
Okay. Well, thank you for your work on that
Much to the chagrin of the district
black
attorney's
gray
office. I should
marijuana
say.
thing, yeah.
They want to make
Much to
every
their
buck
chagrin.
they can.
They want to keep it.
Yeah, and I feel good about that. DOLA, I mean, those people were saying, hey, you know, let's get this done. And
Well, we actually, I mean, the last time we put in for that 12,000, they set the amount, but we weren't really going to put in for it.
Right.
Because of the drought last year, we didn't really have any big grows. And DOLA pretty much reached out to us and said, absolutely should put in for it. So that we can give that money out. So, yeah, absolutely.
We've considered a small drone, not getting carried away, but one that's just small, that we can use to go in and look at the old grows in the forest. I mean, it'll be multi-use. You could use it for a search and rescue mission if you needed to, but primarily to be able to go in and look at these areas where they've been growing in the past, and history
Seeing what's new.
seems to repeat
I
itself.
would
So
certainly think that black and gray marijuana money could be used to get somebody certified as a drone operator
Oh, yeah.
too.
absolutely,
Which I think
right.
we probably are headed there as a county, certainly as a sheriff's office. You don't have one, right?
No.
No.
And search and rescue doesn't have
Yeah,
one.
I know Upper Ark sent 2 of their people to like almost a 2-week class to
Yeah.
get certified.
Yeah, you have
So,
to meet.
Maybe this next go round.
Kind of keeping the FAA
We are looking at that.
altitude
Right.
primarily.
So that you aren't flying
Not
into
getting into the
airspace.
airspace,
Crash plane.
Right.
which is 7
And I
feet above the
suppose that
ground.
grant would cover the cost of a drone as
700.
well.
Yes.
Yes, it will.
Yeah,
So
we're
it'd be
looking at
very
that.
cool.
In fact, we talked to a couple counties that bought drones and funded exactly what we're talking about
Right.
through that grant.
And then, of course,
Some of them got a
you could
little
loan
carried
those
away.
out to
I mean, $30,000 drone. That was
milk.
They had a stretcher under it, delivering inmates to the jail. That's the next thing.
You say that like it's a bad thing.
I mean, it was the drone was something else, but you're talking to the wrong county for that. We were not.
The $32,000.
See a day coming.
Yeah, it flies into space.
Yeah.
I could hire another employee for that.
Thank you, sir.
Thanks,
Thanks,
guys.
Chris.
Work on that, man.
Thanks a lot.
Thanks, Joe.
Today? You going up?
Are you doing the jail job?
Did you want to do a jail?
We need to.
We got time, we can.
We're just about to drop the gavel on this. We could go.
If you don't have anything pressing and you want to, I mean, you guys
Can't do it after 12. If you got time now, we're good.
Yeah, I can do it.
Okay.
I'm
All right.
free anytime, so.
Thank you, sir. Public comment. Thank you for your questions. Those were, I would have never thought about that. I was ready to move forward, so thank you. Chair would entertain a motion to adjourn.
I move we adjourn.
I will second that motion. All in favor, all in favor say aye.
Aye.
Aye, opposed nay. Meeting's adjourned at 11.